Okay, might as well go for it. The webinar's up? Okay.
Good afternoon, everyone. Thank you for coming to our FTAC meeting.
The microphone, I think it needs to be on.
Aloha, everyone. Thank you for coming to our FTAC meeting. A few ground rules. I just wanted to explain a little bit about FTAC and its creation. It is on our attached to the agenda, so you feel free to look at it. But basically, FTAC was created by the legislature, and its membership was also dictated by the legislature. Other than that, the purpose is attached to the agenda, so you feel free to look at it. Now I'm going to call the roll. I'm going to first call those who are here in the room, and that is myself. My name is Kathleen Ho. Ernest Lau. Ernest.
Thank you. Good afternoon, everybody.
Okay, thank you. Claire from EPA. Present. Melanie Lau.
Hi.
And Ashley Nishihara. Okay.
Oh, okay, now it works. Hi.
Thank you. Thank you all for attending in person. We have also in attendance online Dean Ueno from Department of Land and Natural Resources. Dean, are you here? A representative from Nicole Owen's office is. Okay. Senator Mike Gabbard. Present. I see, and Ryan Imata. Okay, thank you. With that, I'll turn it over to you, Keith.
Great. Okay, thank you, and aloha. Welcome to another FTAC meeting. I'm going to try to go quickly through a few aspects of today's agenda and some, house instructions, if you will, and some special instructions to the speakers and others. So if we could go to the first set of slides, Kellyanne. We need to get in the slide mode. All right, so, as with other meetings in the past, it's really, FTAC is designed, since it only comes twice a year, to focus on the major developments and tasks, especially the ones ahead, both now and the next, say, 6 months or so in particular. It's really designed, I think, to increase clarity and understanding, which is always needed in any big environmental issue like this one, where there's a lot of very complex science. With this kind of dialogue, whether we're in the room or online, it's really important to share the airspace. Even though it doesn't look like there's a lot of people in this room, this day can go by pretty quickly, and we want to make sure that the voices are heard, the questions are addressed. So what would really help is if everybody, and I'll do my best to try to keep people on time, but if everybody, the speakers, the FTAC members, and the audience, try to be direct, try to be succinct. A clear question is the best way to try to get a clear answer. And let's try to strive for some constructive dialogue. Kellyanne? Nutshell, this is what the agenda looks like. We're at the top there with the remarks. This won't last long. Then we're going to go into the substantive part, the presentations by several different speakers, public health monitoring, groundwater monitoring and analyses, drinking water updates, and the Red Hill site assessment investigation or remediation. Then we'll take a pause. But in between those presentations and those 4 bullets, we're going to stop for the FTAC members to ask questions. After our break, our 15-minute break, we will have the public comment and question period. And I'll get more into that later on. I don't want to bog that down right now. But I think if you've been to FTech meetings before, it will run basically the same. And then we will finally adjourn. I'm sorry, I'm getting a little feedback here. And then we will finally adjourn. Next slide, please. So this is for the webinar attendees, and many of you, if you're online, you've already attended many webinars before. But just so you know, you're basically having your cameras and your microphones muted until later on during the public comment period if you raise your hand and you get in the queue and then get called upon. So you're going to be seeing basically what the Alelo TV coverage is showing, okay? I think I've covered as much as possible that I need to cover. I'm going to go over this a little bit more at the break so you're clear, everybody's clear about the online participation. Let me just say, though, one of the things we really try to knock our socks off here is to try to make sure the online experience is as close as possible to the in-person experience. We're in an age when that should be able to happen, and I'm really very, very persistent about trying to do that. There's no reason at all somebody should feel totally disadvantaged just because they're not here in this room. So please let us know if you can, if you want to, if it's working well in terms of the visibility, the audibility, because it's really important. Next slide, please. As I said before, be succinct. We can, a lot can be said very shortly. And that's the best way for clarity. Always maintaining civility and courtesy. We do want to always respect each other. And focus on the learning, because I think that this is a unique opportunity to do that. Let me talk a little bit now about just making sure the moving pieces actually work. So we're going to have presenters up here by item, by agenda item. And so you will see 1 to say maybe 4 people sitting here giving their presentations. After they're all done, FTAC members will ask questions of all of them, any of them, okay? Then we'll proceed to the next agenda item, okay? And we'll go that way stepwise through. For the speakers, we have a small stage, so we've made the best possible use of it. When your agenda item is coming up, please kind of make your way close to this front row, because what you're going to be doing after these folks leave is coming up and sitting there. That will kind of minimize the dead time, okay? I'm going to try to do 2 things today that are really important to me and hopefully to the audience. One, try to keep us on time and focused, and try to make sure we're actually seen and heard. That's a mechanical thing mainly, right? So if you're down here and you happen to be asked a question, stand up so you can be seen, both by the audience and the cameras. That's the cameras, robotic cameras there and there, all right? That's pretty much the most important thing I can think of. But keep in mind, I want to keep us on time. I want people to be seen and heard. If I prompt you to please get closer to the mic, please stand up, please whatever, don't take it personally. It's just to make sure you can be seen and heard. That's all. I want to end on just a couple of things because it's interesting to me. I've been working on FTech in this kind of role for about close to 3 years. And many of you have been involved in this for decades. So there's a lot to it. But it's been 3 years since that big spill that affected the Navy's water supply. It's been about 10 years since the bigger spill before then. Seems like a long time, right? But remediation is ongoing. And we're in a phase now which I would personally call, based on some of the other environmental things that I've worked on in the past, a mature period. And we're getting more monitoring, we're getting more data analysis and interpretation. There is a period, there's a lot of, during this period, dueling science. You're going to hear it today. You'll hear it in the future. And really, dueling science is healthy. as long as it's dueling science and keeping it on the science. Because it's just been my modest experience that when dealing with these complex long-term issues, you got to follow the science. And the science is probably not going to tell you, oh, you're here. You've got to really dig and dig and dig. And that means keeping your eyes and ears open and your minds open to understanding all of the analyses that are happening. Today is a perfect time, perfect opportunity to try to learn as much as you can, even if you think you don't agree with it. Try to learn as much as you can. That's what it's for, okay? So I hope that is a constructive advice, and I hope you get a lot out of today's session. I'm going to end it there in terms of my opening remarks. And what I'd like to do now is bring up our first speaker, who is Elizabeth Boyle. And if we could bring Elizabeth up first before I introduce her, so everybody can see. Hello, Elizabeth. Elizabeth is joining us from the East Coast. She's with the National Academies of Science, Engineering, and Medicine. I'm going to leave it at that, Elizabeth, and you can just jump into your opening remarks and presentation. Can we boost the volume? Sorry, Elizabeth. Little temporary audio thing here. Bear with us just a second. While we're waiting, Elizabeth is graciously joining us 6 hours ahead. So it's your, what, 7 o'clock, 7:30? Yeah. Go ahead. Barely. Sorry.
Let me see if it's on my end. Let me switch to a different microphone.
Keep on talking. Tell us jokes. Yeah. Go ahead, Elizabeth. We need to hear you in order to test.
Yeah, so can you hear me now?
It's very faint in one here. It's not coming through these main speakers.
Yeah, so Ruben, looks like everyone on Zoom can hear me.
I think it would be better if you were able to be fully heard first. Hopefully we saved a little bit of time on the intro. But they're working quickly. Usually these things don't hang us up too long. Probably not feedback. Okay, we can do, I'm going to ask the tech team, we can do something here, which is to switch to our live speaker first, if you're able to do the fix on the Zoom independently. Would that work? Exactly, yeah. I don't know if you guys heard me. Give me a thumbs up. We can go to the live speaker first. You can continue to work on that, or is that going to throw you off? Okay, are you prepared to go? Okay. In the interest of time, I'd like to suggest that we switch to Dr. Weldon first, to give her presentation live. Liz, this won't keep you any longer, but will hopefully make you audible. I'm really apologize for the situation. Okay, so if we're able to change the slide deck to Dr. Weldon's, Dr. Weldon, the floor will be yours, and then we'll go to that view, and then we'll come back to you, Elizabeth. Yeah, let's go through. It's kind of sticky.
Hello? Okay, I can be heard. In the interest of being seen, I will stand over here, but I would like to apologize that I was only initially going to be giving half of this presentation, so I will rely on my notes, unfortunately. Thank you for having us here today. My name is Rosanna Weldon. Most people call me Sonny, and I am here to speak about the Red Hill Registry. My colleague, the Director of Community Engagement, Tara Sutton, was originally supposed to be here today, but unfortunately she was unable to make it. So the affected community has long called for just really wanting to know more about the potential health effects of their exposure to jet fuel. And so, oh, thank you, that helps tremendously. The full impacts of the Red Hill water contamination on them. And so the registry has been supported by state and federal agencies, including CDC, ATSDR, Hawaii Department of Health, of course, EPA, and Defense Health Agency. And of course, everybody really wants to get to the bottom of what potential health effects may arise from this situation. So in the summer, this past summer, June 20th, we were awarded, the University of Hawaii was awarded with the funds to establish the Red Hill Registry. Now, we are being funded by the National Centers for Disaster Medicine and Public Health through the Uniformed Services University of the Health Sciences. Now, what is interesting about NCD-MPH, as they're known, is that they are also coordinating this ecosystem of university and other partners across the United States who are able to rapidly respond in disaster situations. And so now the University of Hawaii is part of this ecosystem, we could also be called upon in future disasters. But this is the mechanism by which we were funded for the registry. Now, the goals of the registry are threefold. Of course, we want to connect the community to any needed services through a referral program that we will be developing. We plan to develop all of the registry with community input. We really want to learn what the community needs are first before jumping too far ahead. Any of these referrals could be to healthcare services or to social services, or even to things like housing referrals. We're really trying to think broadly about what a referral system will encompass. We also plan to have an education component where we will provide education programs for community members, of course, but also for their healthcare providers, because what we are finding is that now that this population has potentially dispersed globally, it's been a few years since the incident, that healthcare providers may not necessarily be aware of this exposure scenario, or specifically of any of the health impacts that may arise from this exposure. So we plan to develop that for healthcare providers. And of course, the registry's main duty is to track and monitor participants' health status over time, so that we can gather more information about any potential links between exposure and health outcomes. Now, I should say, importantly, we are currently in a planning year. We do not expect to enroll participants until about the fall of 2025. It takes quite a lot of work to figure out our infrastructure and to just get enough community involvement to make sure that we're doing everything correctly, and, the first time as much as possible. So right now, during our planning year, we are building our infrastructure. We are hiring. In fact, I'll show you later on our website, we have a little button that has employment opportunities on it. We are developing our website. We are setting up all of our IT infrastructure. Importantly, we are really developing our community engagement program. And right now we're planning some focus groups with the community. We have not advertised anything yet because we're really just trying to build everything from the ground up. But we will be in touch with the community soon about when these things happen. We also were tasked as part of our deliverables with preparing a report to Congress on the feasibility and necessity of conducting an epidemiological health outcome study on the Red Hill population. This report to Congress, it really was a good start to our registry because it got us thinking about all sorts of things, like what eligibility criteria might be important, or things to think about in terms of access to care. And of course, we all agree that these epidemiological health outcome studies are important in this population. So that's what we've been up to so far, and we'll continue building our study instruments for this next year. Next slide, please. I wanted to briefly introduce just, the overarching University of Hawaii registry team. Now, we are situated in the Office of Strategic Health Initiatives at the UH system level. And so I am the director of the registry, but our principal investigator is Dr. Amy Grace. We have our director of marketing and communications here in the audience today. And then, of course, we have an operations manager, and you probably all know Tara Sutton, our director of community engagement, because she goes to a lot of public meetings, and she's very well connected to the community. But we also, part of our team, we are collaborating with the Thompson School of Social Work and Public Health, the John A. Burns School of Medicine, the Water Resources Research Center, which I'm sure many of you have worked with as well or heard from, and University Health Partners of Hawaii. Next slide. So next slide, community engagement. So this is more of Tara's wheelhouse. So far what Tara has been doing is identifying stakeholders among community members across local businesses, advocacy groups, academic spaces, and within the medical community. Of course, she's also been reaching out to federal and state partners, federal agencies, and even DoD partners. So soon she will begin to gather insights from a variety of perspectives, as I mentioned before. Here in Hawaii, there's a concept called Makawalu, which speaks to the importance of seeing things from multiple perspectives. And while Tara has not been formally trained in any traditional practice per se, she really thinks it's important to consider diverse viewpoints, and is deeply invested in listening to all the different stakeholders. And she wants to make sure that all of these perspectives align with the registry's approach of listening to all these voices as we move forward. Next slide. So as the Director of Community Outreach, she will be hosting listening sessions with impacted individuals, water users, professionals, leaders, as well as setting up a community oversight board or a community advisory board, and various workshops where we can get together and discuss these issues to ensure that the registry is truly co-created with the community. In addition to outreach, she is laying the groundwork for a couple of major milestones that are coming up on the horizon. And these are establishing the community oversight workshops, which will act as a collaborative force helping to steer the registry forward constructively. She'll also be identifying material that is needed for the educational program, and the kinds of outreach programs that are needed by the community. Next slide. As I mentioned before, we have a very rudimentary website. We intentionally wanted it to be a very basic website because, as I keep mentioning, we want to co-create this with the community. And so we will be asking for input on things like, logoing and the best way to reach people. And so right now we just have a subscription up on our website, an opportunity for people to subscribe for updates. This is not enrollment to the registry. I want to make that very clear. This is, if you want to leave your email address with us, then we can contact you for things like these community listening sessions or any other events that we may have coming up on the registry. As I mentioned earlier, there is also a little employment button in the top. When we do have job opportunities, we would love to hire from within the community. And so every once in a while, it would be great if you would check out our website, check to see if we have job opportunities, and apply. We'd love to hear from you. Next slide. And mostly I would like to thank all of you for inviting the Red Hill Registry to be a part of this FTAC meetings today. It's important for us to get the word out to the community that we're doing all we can to help in terms of tracking, monitoring, and especially in providing referrals to needed services. So on behalf of the Red Hill Registry, we want to acknowledge the Red Hill community and the people of Hawaii who recognize the problem and are still fighting for answers. So feel free to see us on our website. Thank you.
Okay, thank you very much. I'm going to do a quick check with our tech team. Are we good? All right, let's then bring Elizabeth back up.
Hello, can you hear me now?
Oh, wonderfully, yeah, loud and clear.
Oh,
But we're waiting to see you too, so one thing at a time. Oh, perfect.
great.
Okay, well, Elizabeth, please just give us self-introduction and then just go ahead.
Yeah, hi, I'm a senior program officer at the National Academies of Sciences, Engineering, and Medicine, and I have the honor and privilege of presenting to you our new study on the clinical follow-up and care for those impacted by the JP5 releases at Red Hill. And this project is sponsored by the Department of Defense and the Veterans Health Administration. Can you see my slides now?
Yes.
Okay. I edited them just a little bit from the ones that were posted online. So you may be wondering, what is the National Academies of Sciences, Engineering, and Medicine? So what we are is we're a non-governmental organization that advises the nation on issues related to science, engineering, and medicine. And we have a dual mission. Like the first is to serve as independent scientific advisors to the nation through our operating arm, which has 7 divisions and 60 boards. And then also we honor top scientists through our honorific academies, the National Academy of Sciences, National Academy of Engineering, and National Academy of Medicine. And becoming a member and being elected to one of those academies is a huge scientific honor, and it's close to being a Nobel Prize winner. And some important things to know that the academies are not, and it's that they're not part of the government, not an advocacy organization, and not consultants to for-profit entities or research laboratories. And so some typical activities that we do are what we call consensus studies, and consensus studies produce authoritative reports that provide independent, objective, and nonpartisan scientific and technical advice to inform complex problems. Then we also will hold expert meetings and workshops, like symposia or other meetings, to connect professionals and stimulate dialogue on diverse issues. And then we also have communications and outreach, and we have a wide variety of different products that do that. And so what's important to know is that this is an activity, a consensus study, and we will produce a report that provides advice. And so how we produce this report is we have several different steps, and some of these are not quite stepwise, some of them overlay and happen at the same time, but we start with a study definition, and out of that we develop what we call a statement of task, or sometimes you'll hear people call it a charge to the committee, but it's really like the scope of work for what is this report supposed to say. And then we'll move into our after that's selected, then we get a contract from the government to carry out this work and then work independently from really that point forward. And so now we're at the next step in the process where we're in our committee selection phase. And so we look based on the expertise required to produce the report and freedom from conflict of interest, and also balancing all the perspectives that are needed to address the statement of task. We'll form a committee. And then once the committee is formed, we'll start our information gathering, which we do through public meetings, other outside submissions, literature reviews, and committee investigations. And then after all of the information gathering, then we move into the report development phase, where the committee gets together and writes the report, and develops their findings, conclusions, and recommendations that are all based on the information that they gathered. And then once the report is developed, then it goes through a very rigorous scientific peer review process. And then after we've appropriately responded to the peer review, then the report is released to the public after the approval. And so our statement of task, and this is a little bit abbreviated, but our ultimate goal is to recommend guidance on clinical actions for monitoring the health of community members who were exposed to the November 2021 release of JP5 at the Red Hill fuel storage facility. And so in order to provide that advice, what we'll do is we'll engage with exposed community members to understand health issues and experiences, and then we'll review the scientific evidence on long-term health risks associated with JP5 exposure, and so those will come from the scientific literature. And after that review, then we'll determine the strength of evidence for the putative health effects associated with JP5 exposure, and then review existing clinical guidance for any of the health outcomes that are determined to be associated with JP5 exposure. And then in order to understand the different levels of exposure throughout the community, we'll look at various exposure assessments and models that might have been done that could be used to and see about their utility to be informative for the clinical follow-up. And then we'll put all of that together in order to provide recommendations on clinical surveillance, testing and care, and also to identify research needs. And so a report that provided similar advice was one that I worked on a couple of years ago called Guidance on PFAS Exposure, Testing, and Clinical Follow-Up. And in that report, one of our primary recommendations was for clinical follow-up for conditions associated with PFAS based on different exposure levels to PFAS. And so our work plan is that we'll have 15 scientific experts that'll serve as volunteers on the committee, and then the committee will meet at least 3 times in person and probably hundreds on Zoom. One of those meetings, and that will be the first meeting, will be in Washington, D.C. In either December or January, depending on the availability of the committee once they are appointed. And then we'll have one site visit in Town Hall in Oahu, and also then a report release event in Oahu. And so throughout the whole project, we'll engage with the community, and that will happen through a variety of methods. We're thinking about appointing a panel of community liaisons to meet with the staff throughout, like about once a month throughout the study, because that's a method we used in the PFAS study that I mentioned. Then also appointment of community members that could be consultants to the committee. And then obviously the in-person town hall that was already mentioned. And then at all of our meetings, we have open sign up and speaking slots at all of our public meetings for anyone to sign up for. So members of the exposed community can have those slots too. And then sometimes we have online surveys or other data gathering throughout a study. And then also this is common to all National Academy studies that written submissions are able to be submitted to the committee. You can email us at redhill@nas.edu at any point in time. And so some of the areas that the committee could consider or needs to consider when engaging with the community, and these come from our report on PFAS, are environmental justice, thinking about the socio-historical processes in a community and the complex roles of all the people involved. This is based on Pello's environmental justice framework, the effect of inequality on different stakeholders, and then also the individual's agency or ability to make change for themselves. And then another factor that was important to this previous committee on PFAS were the Jemez Principles for Democratic Organizing. And so the National Academies has strict rules about no biases and no conflicts of interest for the committee, but there are ways that we were able to employ some of these in our work with the community throughout the PFAS report. And the ones that were most relevant to us for that project were to be inclusive and to make sure that people had the opportunity to speak for themselves. And then all of that, this committee will put together and come up with a community engagement plan that'll be used throughout the study process. And so our timeline is like right now we're in the committee formation phase, and as I mentioned, we hope to finish that and start having our first public meeting either at the end of December or sometime in December or January. And then we'll be in our information gathering phase until about a year from now, or a year from then. And then we'll need to submit the report to peer review in December of 2025. And so if you're interested in providing information to the study committee, getting that to us before December of 2025, it will be the most useful. If it's before it's developed and submitted for peer review. But then the peer review process takes a few months, and the report should be able to be released to the public in March of 2026. And so that's it. So thank you so much for your time, and I'm happy to take any questions.
Thank you very much, Elizabeth, and apologies for the delay. Just to put
No worries.
just to put a little local context, when she mentioned the National Academy of Sciences being a big deal, University of Hawaii just has a few, and one of them was Professor Ryuzo Yanagamachi, the mouse cloning genius, but he laid a lot of the foundation for in vitro fertilization decades before. It's that caliber of scientist with that type of expertise that is brought to bear on different things. So with that, I'd like to
Sometimes our reports are referred to, sorry to interrupt.
Go ahead, please.
Sometimes our reports are referred to as like the Supreme Court of Science. So
Yeah.
this is, they have a lot of esteem and a lot of power when they're finished, or at least we hope.
Okay, so let's pivot now to FTAC members. Just raise your hand and start. Okay, Ashley.
Hi, just wanted to say, first of all, thank you to Ms. Boyle and Dr. Grace for your work and opportunities and resources for the community. Really appreciate it. I have a question for Dr. Grace, just really quickly. The Red Hill stakeholder map, that slide, I couldn't see what was written inside those little dots, those little white and black dots, and I really wanted to know if there's a place where we can look at it.
Right now, that is intentional that you couldn't see inside the bubbles.
I see.
Because we're still building the map and we didn't want anybody to feel left out. But if you want to make sure you're included in the map, you should definitely let us know.
All right, so it's just like a placeholder, like blah, blah, text.
I mean, there are people in the bubbles that we have already identified, but we haven't identified them all yet. And so we do want to make sure we're as inclusive as possible. And so we want to hear from individuals who would like to be on our stakeholder map, and entities, companies,
All right, gotcha. Thank you.
Thank you.
Okay, next question, and just for the tech team, there's a slight ring to this speaker over here, if that can be fixed. Dr. Lau.
Hi, can you hear me?
Yep.
Okay. This question actually is for both of you. Why are both of your entities interested in this topic now? I remember the National Academy of Sciences being really hot stuff, and why is this topic of interest to you, and who funds you? And the same question goes to Sani.
Okay, maybe we can start with Elizabeth and then Dr. Weldon. Did you hear the question? Okay.
Yeah, I heard the question. So this project in particular was funded by the Department of Defense and the Department of Veterans Affairs. So we have a history of providing advice to the Department of Veterans Affairs on conditions and their associations with military exposures. We have a series on Gulf War Health and another series on Agent Orange that are pretty well known. And that the VA then uses those reports, and what our reports say are associated with exposures to service, and uses those to develop service-connected conditions and provide coverage and care for veterans. And so that is, I think, part of why we're funded to do this here.
Okay, and Dr. Ward?
So I would first answer the first part of your question, why am I interested in this? I am an environmental health scientist by training, and so I am always interested in the associations between exposures and health effects. And so I actually started conversations with various people at DOH and EPA, and early on, right after the incident, it wasn't entirely clear how the University of Hawaii could help at that point. And then, so when funds, so really, there have been many conversations about starting a registry with ATSDR. Had these conversations, the ATSDR ACE investigations happened, and a lot of the questions still weren't quite answered yet. And so ultimately, the funding became available, and the mechanism for the funding is that disaster center, National Center for Disaster Medicine and Public Health. The funds are effectively DoD funds, but because there are so many layers in between, and because the University of Hawaii is completely independent from DoD, our registry is independent from DoD.
Thank you. I think both of you hit on a point that I was wanting to kind of bring up is the impacted community has a lot of distrust, and by mentioning DoD, I can already see some eyes glazing over. I'm pretty sure your first slide, National Academy of Science slide, said that you are independent, and I'm hoping the Red Hill Registry is also independent, although it is funded by NDAA, which is still a defense thing. And I'm a little bit worried that you guys are going to run out of money after your 5-year project. National Academy of Science is independently funded. Is that still correct, is what you said on your first slide?
We operate independently, but our funding is for a 2-year project. And so that when the report's produced, then it's produced and it's on the website. And if you need another engagement with the academies, then it requires more funding. And I just also wanted to add to what Sani said earlier is that, when I released the report on PFAS that I mentioned in my slides over 2 years ago, someone from the Red Hill community messaged me during our public release event and said, "Can you do this for Red Hill?" And I was like, absolutely, I want to do this for Red Hill. I mean, I think any exposed community deserves to know what the associations between their exposure and the potential for health effects. So, for those reasons, like that's me personally why I'd like to get involved, but I know why the agencies also sponsored it.
Okay, Ernie, any questions?
Yeah, thank you. Ernie from the Honolulu Board of Water Supply. I have a few questions. How is this coordinated with the, I think what the CDC or ATSDR was supposedly doing? And how is this being also work? Is there any connection with the defense? I think it's called the Defense Health Agency. And how will this play into providing care for the affected families, both military and civilian population that were directly exposed to the contaminated water at Joint Base?
Is that a question to both or just?
I guess it would be to both. Maybe
Okay.
take the University of Hawaii first and then the National Academy second.
So we are informed by the ATSDR ACE investigations that have already occurred, I would say. So that helps us to develop our study instruments for the registry. What sorts of health effects are we thinking we might be seeing in the population so that we can ask more pointed questions about those sorts of health effects and follow those issues over time. And also to think about what long-term health consequences might be as a result of some of those early symptoms that we're seeing. So those ACE investigations are very important to us. And also they gathered some more demographic and background information, things, in addition to, I'm not sure if you knew that there was also a UHERO study that was done out of the University of Hawaii. So all of that information from that population is very informative for us in developing our study instruments and understanding the population. Things like access to healthcare and trust in, all the entities, very important to us. Now, the second part of your question was more about, I'm sorry.
I think all of this is important because at the end of the day, you have impacted families, people that were exposed, civilians and active duty military personnel. So how does it improve their situation or provide medical care, health care over the long term for their families?
So the registry is not tasked with providing health care itself, but we are planning a referral program so that we can connect individuals with services, not necessarily healthcare services, but what's the services that are needed by the community. As I mentioned, it could be, housing referrals, or it could be social services, or other sorts of services that are needed. And part of that will be assessed within our baseline questionnaire. What are the services that are needed? And also in our community engagement over this next year. But I also wanted to mention, back to the other question, I think you had concerns that we are funded for 5 years at the moment. I mentioned that report to Congress that we wrote. We're hoping that that is a persuasive report to Congress, that this sort of registry it's important to continue it not just for 5 years, but for decades, so that we can start to look at the long-term health consequences of these exposures.
So maybe if we could have Elizabeth also start to address from her perspective.
Yeah, so I would say about the ACE investigations, that first part of your question, and how those are reports that'll be informative to my committee. So one of the key differences between what Sani's doing and what my project is doing is that we look at published literature and engage with people that will inform how to interpret published literature, whereas Sani will be collecting data through her registry. And so that's a key differences between our two efforts. But so the ACE investigations are published reports that my committee can review and inform, how they make their decisions. And then to your question about how our report may be impactful to those, families that were exposed and how it can impact their lives, is that we'll be making recommendations that'll inform DOD and VA, and they can make then clinical guidance for their providers that will then, hopefully improve their clinical care. And the report itself too will be available to the public. So even if they receive care from another type of provider that is not our sponsors, anyone can use the report and their communications and advocate for themselves.
So
I hope that helps.
You create a report, but it's actually, the question is, how will that report be used effectively to make a difference for the impacted families?
So I can actually answer that. I meant to follow on after she just said that. Is part of our registry is also to develop those education programs also for healthcare providers, so that once their report is finished and we know a little bit more about some of the symptoms and best clinical practices, right? That'll be part of your report, Elizabeth. And we can then create our educational materials for healthcare providers to best support and help and care for impacted individuals. We really don't, we're not doing the same thing, but what we are doing is very, it works well together.
Thank you. I think this is very important, and it may be a request to our State Department of Health on behalf of those impacted families to actually leverage this information once it becomes available to improve the situations with the impacted families.
I just wanted to add on another thing about the health departments. So when we released the report on PFAS, there was a guidance, like within a week, the North Carolina Department of Health put our guidance on their webpage and said, here, clinical providers use this. So, there are ways that if they choose to, specific agencies can, leverage the report's recommendations.
And Elizabeth, would it be wise for people who have questions like that to look at the PFAS study as an example of what types of advice, guidance is provided to practitioners?
Yeah.
So that would be
I can provide a link to that. I don't think I had a link to that report in my slides, but I can provide that as well.
Okay. Let's take
You could
one
also
more in the interest of time.
Google
so we
National
can-
Academies PFAS, and it would come up too.
Right. Melanie, Dr. Lau?
Yeah, I have one more concern. It sounds like you're going to be drawing from the same population, the people who are affected, both the civilian and non-civilian population, and they've been surveyed and asked questions up the wazoo for the last 3 years. I don't want anybody to be fatigued And, you know, it sounds like you're going to have your focus groups about a year or at least 9 months ahead of the UH one. And I kind of want to point out to everybody that please participate in both of them so that we can get more information and more help. And they do sound complementary to each other, and it might actually help us in the long run.
Great, thank you. So, you know, with the glitch we had, we're a little bit behind time, but, you know, we kind of had the same amount of time budgeted when we got going for this. So I really appreciate both of our speakers taking the time. As you heard, they're going to be out there in the community a lot at different points in time. And so you will have a good chance to interact with them and studies that they're involved in. But thank you very much for your time, especially you, Elizabeth, on the East Coast. I really appreciate it. So with that in mind, I'd like to switch to our next group. Bob Whittier is going to come up with... Okay, good. And then we're going to have another Zoom speaker as well, Professor Don Thomas from the University of Hawaii, who will be coming in remotely. So while they're positioning themselves, we'll, you know, explain that this next section is, you know, taking a big pivot from public health and clinical care to groundwater analysis and monitoring, and a couple of new, I guess, interpretations that I think are going to be part of the panoply of different ways of looking at what may be happening in the groundwater. Every time I think about groundwater and groundwater modeling, I think back about 35 years ago when I was trying to do numerical modeling on traffic. It's hard enough to do that on something you can see. It's really, really hard to do that kind of stuff when it's underground. So I want to turn it over to Bob Whittier, who is with the Department of Health. Bob, you can use either microphone, and you can stand if you wish, and come over this way with the, I'll pull that guy out for you. And that is your screen. And if we can bring up Bob's slides, there we go.
Well, thank you. There have been detections of potentially petroleum-related compounds in the Idaho wells.
I think it's switched off.
Okay, you good to go?
Yes.
Okay. Next slide. Okay, these compounds are known as polycyclic aromatic hydrocarbons. And they are a group of compounds that are produced by the incomplete combustion of organic materials. And scientists commonly link these compounds to a source based on their molecular weight. Detections of pH in a public drinking water well are of significant concern to the Department of Health. And we initiate an investigatory process to evaluate the root causes. And what follows is a result of our preliminary investigation. So the guiding question, is contamination at Red Hill the source of the pHs observed in the IA2 wells? Some of the factors that we examine include data collected at both the Red Hill and other area wells, molecular weights of these detected pHs, the distribution of the concentration of the pHs, and the characteristics of the plume as they move past a well. Differences in these factors can help determine whether the source is nearby or more distant. Next slide. So there are many sources of pHs in the environment. Some are natural. That would include natural petroleum seeps, vegetation decay, also fires, wildfires, and volcanic eruptions. Of greater concern for us are the anthropogenic sources of pHs, and that includes petroleum spills, such as has occurred at Red Hill, pesticide formulations, pH contaminated medium, road dust, exhaust from both jet and internal combustion engines. We put these basically in two categories. One would be petrogenic, or the product of dissolution of fuels, such as would occur with the spills at Red Hill. Okay. And pyrogenic, and that is a product of incomplete combustion of materials such as car exhaust, incinerator smoke, and cigarette smoke. Next slide. Okay. Different sources of pHs have different molecular weights. On the low end, we have the fuels that were recently stored at Red Hill, which include diesels and jet fuels, JP5 and JP8. On this scale, they are about the lower quarter of those pHs. If we're looking at the fuels that were historically stored at Red Hill, like Bunker C, that extends significantly up past midway. But other sources of anthropogenic pHs include industrial, residential, and combustion, and they actually spread across the whole range, going beyond the ones that are listed in this diagram here. But it must be noted that also occurring at Red Hill were industrial and combustion activities. Next slide. So the transport characteristics of pHs also vary by molecular weight. Again, at the low end, well, let's look at the two primary processes by which transport is affected. First would be solubility. In their pure form, pHs are a solid. Think of mothballs, which is naphthalene. So solubility is the ability of a solvent such as water to dissolve naphthalene. That ability decreases with increasing molecular weight. Another factor or another process is sorption, and that would be the tendency of a PAH to adhere to a solid particle or surface, such as suspended particles, sediments, or aquifer matrix. Taken together, sorption increases with increasing molecular weight, and solubility decreases with increasing molecular weight. So that those things on the lower end there are generally more transportable, can move better in the groundwater than the heavy molecular weight pHs. If we look at what was detected at the AOLs, they go from the upper part of the lower range and all the way beyond the what the pHs that are listed on this diagram here. Next slide. Next would be look at the distribution of the concentrations of the pHs. Here we sum the 4 pHs that made up a majority of the mass detected at the IOLs. And so we start at the potential source area, which would be Red Hill. And within the footprint, we see a moderate concentration in one of the older wells, RHMW02. When you start moving out from that source area, the concentration decreases significantly. If we go across the valleys, then we see in the lower part of Halava Valley a trace concentration. There was a trace detection of a pH other than these 4 here in the Halava well field. But we get to the IOLs and we see a significantly higher concentration. And this is pretty significant, as we'll discuss a little bit later. Next slide. The other thing is, what are the potential sources of pHs in this area? So there's 2 groups here. One's that we've actually sampled and quantified for, and that would include the Red Hill Fuel Storage Facility and associated spills, have verified detectors of pHs. If we move across the valley, we look at Halava Stream, The sediments of Halava Stream have been sampled, and even above or upslope from the Halava Shaft, pHs have been detected, as well as down near the mouth of Halava Stream, where it discharges into Pearl Harbor. Moving more toward Aiea, at the site of the old Navy Exchange laundry, there was a UST removal, underground storage tank removal, and there are pHs detected in the monitoring wells there. At the site of the old Aiea sugar mill, there were pHs detected in the soil. A couple of other sources that have not been quantified would be that from truck exhausts from trucks moving up and down H3, and also a residential fire that occurred in March of 2024, fairly close to the Aiea wells. The next slide. Let's look at the makeup of the pHs at Red Hill and also at Aiea. By total pH mass, Red Hill RHMW002 within the footprint of the tank farm has a significantly higher mass. However, it is almost exclusively the light molecular weight pHs, consistent with the recent fuels that were stored there. Only a very small fraction of that is heavy molecular weight. If you look at the pie charts here on the left, at the Aiea well, almost exclusively heavyweight pHs with only a very minor contribution of the lightweight pHs. And looking at the heavy molecular weight pHs across the board, the Aiea well has the highest concentrations. Okay, next slide. As a dissolved plume moves from a source out through the aquifer to let's say a receptor well, the nature of that plume changes, both in concentration and in the pattern of the trace. A tracer test was conducted in central Oahu. Duration and the amount of tracer added was actually reflective of a fuel spill. And what we've seen is that at the source, the concentration was orders of magnitude higher than at the nearest monitoring well, about 33 meters away. Now, it must be noted, this monitoring well is probably off the center line of the plume, and that would affect the lower concentration. But we moved to the next well, which was 160 meters away, and its concentration is about an order of magnitude less than at 33 meters. And that well is more likely within the center line of the plume. The other observation is that near the source, the trace of the plume is more bumpy, humpy. As you move away, it becomes more smoother and more depressed. If we look at the Aiea wells, we had two detections separated by non-detections between before and after, giving it a bumpy appearance, more consistent with a more close source rather than a more distal source. Next slide. So, lines of evidence that the pHs originated from an alternative source include, to date, the only petroleum-related compounds detected at the Aiea wells have been PAHs, and that is unusual. The BWS wells have been shut off since 2021. This will increase the influence or the relative impact of nearer sources of contamination. And there are several nearby sources we discussed earlier, but also potentially sampling error and sustained rainfall and recharge, particularly recharge, just prior to the sampling event would move anything on the surface downward into the aquifer. And there was only a minor detection of a PAH at the Halava well field, which is between Red Hill and the Aiea wells. And finally, groundwater flow direction. Currently a lot of debate, it's currently not defined. DOH has previously postulated a groundwater flow direction from Red Hill toward the Aiea and Halawa area. USGS in their most recent reports state groundwater flow direction is Magna or down ridge, which would be in conflict with transport from Red Hill toward Aiea. Next slide. So our preliminary assessment is it is unlikely to reasonably believe that the Red Hill was the source of the pHs detected at the Aiea wells, and more consistent with urban industrial activities. And the characteristics of the Aiea detections are inconsistent with long-distance transport, and no other expected petroleum-related compounds were also picked up at the Aiea wells. Thank you.
Okay, thank you, Bob. He's going to be up here. He's going to remain here for questions when we get to that. I'd like to quickly shift over to Professor Don Thomas, and he will supplement or continue on with a different analysis of groundwater flow. Don, we're ready for you when we can see you. So we can see your slides now, Don. And if you haven't already done it, Don, if you could both unmute yourself and turn your camera on. There you are. And make sure you unmute yourself. We still can't hear you. Is it possible to unmute him from the webinar in the back? Okay. Or send him a message. Don, if you can hear us, we still can't hear you. There you go.
It went to my screen and I wasn't able to
Yep. Okay, here you go. You're up.
unmute. Okay. So, because my time is very short, I'm going to summarize quite a lot of data, but we'll be happy to answer questions at the end of the presentation or during the question and answer time. What I'll be doing is talking about a study that we've undertaken within the Pearl Harbor Basin to really gather field data to tell us the direction and rate of groundwater flow. And I wanted to give our takeaway messages first, given the short amount of time. Important things to understand: groundwater flow is controlled by the geologic structures that it's passing through. If we're going to understand the hydrology of an area, we need to understand the geology. And the Pearl Harbor Basin is among the most geologically complex regions of Hawaii, given the age of the volcanism, or varied age of volcanism, and the complex history of Oahu Island.
Don, if I could interrupt you for just a second. Do you want to be showing your slides now, or you want to
Yes.
be...
Okay. Are you not seeing those?
No, we're not yet. So I think you have to share screen.
Okay, I'll share screen again.
Okay.
My apologies.
We see a very vivid picture behind you. Okay, now we see it.
Okay.
And best if you can put it in presenter mode.
Right.
There, perfect.
Okay. So again, groundwater flow is controlled by the geology. We have to understand the geology to understand the hydrology. This is a very complex region, and preliminary conclusions that we can draw right now is that the conceptual groundwater flow model that was selected by the Navy as the basis for the numerical model that's used to compute flow rates and directions doesn't incorporate some very important geologic features that are present in this region. And so those flow trajectories are in strong conflict with what we're finding in our research. More broadly, the conventional picture that we have of groundwater storage and flow in Hawaii and on Oahu in particular really does need to be revised. Our findings really strongly indicate this. So our purpose in undertaking this was to use modern tools and methods to develop a better understanding of the regional geology, document groundwater flow rates and directions, and validate those findings through execution of a dye tracer test. So let me speak briefly about the geology. We are looking at this region on the leeward flank of Ko'olau volcano. This surface is about 2.5 million years old. It's deeply dissected. It has undergone submersion in seawater. There have been higher and lower stands of the sea that have deposited sediments up into these valleys over the last 2.5 million years. And there's also been recent volcanic deposits. Some of the best known, of course, would be Punchbowl, Salt Lake Crater, Aliamanu Crater. And within this region of Salt Lake and Aliamanu, because they are located right below Red Hill Shaft and Red Hill Ridge, they were of particular interest in some of our studies. One of the studies that we performed is gravity surveys. Gravity surveys allow us to measure the density of the rocks below the instrument that we're using to make those measurements. And the area of investigation focuses on Aliamanu and Salt Lake Crater and this square here. The gravity data shows us very high densities here at the core of these craters that suggest magma that has been intruded underground, which typically is very dense and potentially could impede flow of groundwater through this region. We also have significant deposits of sedimentary materials that are much less dense, these lighter blue colors and yellow colors. And the sedimentary material is not very good at flowing water and can actually serve as a barrier to flow. So one of our techniques was to look at these valleys, buried valleys, and try to determine the depth to which the sedimentary material is deposited, because where it intersects the water table, it will reduce or in fact even stop flow across that valley fill material. This is an image from the electrical resistivity survey that we did in South Halava Valley. The green and yellow colors are the electrically conductive material reflecting the sedimentary deposits. The electrically resistant basalts are in blue and light blue. And so this has allowed us to image the depth of valley fill and identify where along South Halava Valley groundwater could potentially move in a northwesterly direction towards Halava Shaft or towards Aiea, and where this valley fill material would block that. Another technique that we've applied is using an instrument that allows us to directly measure the groundwater flow rates in some of the existing monitoring wells. And we have looked in particular at the wells here. The red generally outlines where the fuel tanks are. So the monitoring wells near the fuel tanks we have looked at. Here in this general area is Red Hill Shaft. And so the wells in the vicinity of Red Hill Shaft have also been tested for direction of water flow. And then a few more distal wells have been looked at. Our data looks something like this. The red points are direction of flow, and after this early section of the plot is immediately after the camera system goes into the well, and it takes a little while for the water to settle down from that disturbance, but we can get a measure, average measure of the direction of flow. The blue points are the rates of flow. And in this particular case, we're seeing very good horizontal flow. Direction of flow is about 110 degrees south. And we get this, but this is an example of good data. We have some other wells, though, where there is no detectable flow direction. We may have flow up the well, which is suggesting that we have pressurized zones below that well that are moving water upward into the shallow aquifer, or we have zones that are absolutely stagnant. And some of those wells, as I say, are here in the region of the fuel tanks. This well here in MW24, what we found was that 120 degree at high tide, 110 degree flow direction at high tide. Low tide, it was actually more like 160 degrees south water flow motion. And as I say, we are continuing to work up this data. It is very complex, and it will take a while for us to complete this work. The most striking data, though, that we have acquired to date is shallow marine resistivity surveys. We performed a number of these surveys offshore of Pearl Harbor, and in fact in Pearl Harbor as well, as well as along the shoreline down across Waikiki and even beyond Waikiki, out towards the eastern flank of Oahu. And I'm going to talk specifically about this profile, and the results are really quite striking. The blue colors are more resistive rocks. The yellow and orange colors are the more conductive rocks. And one of the principles of this method is rock that is saturated with seawater is going to be more conductive, whereas rock that's saturated with fresh water is going to be less conductive, or I should say fresh or brackish water. And what this is depicting is the cap rock, and again, this is offshore of Pearl Harbor, cap rock that extends down to about 300 meters depth below the ocean surface. A good portion of that is saturated with salt water. However, these light blue colors here are indicating that we have brackish water present as well. And even deeper below the cap rock, we're seeing the very deep blue resistive rocks that are suggesting that we have a freshwater body that's extending out into the submerged flank of Oahu and discharging into the deep ocean. So our conventional picture that we have of Oahu's hydrogeology is that we have this basal freshwater lens. We have very hydraulically conductive, very permeable basalts above. The water within the basal lens is very well mixed and travels easily. We've got brackish water below through the transition zone and then underlying salt water. And the cap rock effectively blocks discharge of that fresh water out into the ocean. We believe that that latter data suggests that we need to revise that model to actually show fresh water infiltrating into the cap rock and, discharging into the shallow ocean, and a freshwater aquifer that is passing below the cap rock and discharging out into the deeper ocean. It's also possible that we have other confined layers that carry these purpose of these blue arrows is to suggest that there may be other confined freshwater aquifers that discharge even more deeply. Now, this is not the first time we've seen this process go on. We have done similar work over on Hawaii Island, where on the west side of the island we saw something quite similar to this. We did some deep drilling on the east side of the island where we also found deep freshwater aquifers well below sea level and well below saltwater saturated rock. So I'd like to claim credit for this as a new idea, but in fact, our data validates work that was really first described more than 70 years ago by Chester Wentworth of the Honolulu Board of Water Supply. Chester had done a very detailed analysis of the artesian wells and saline wells on the shoreline in the Pearl Harbor area. And he had suggested that in fact there is fresh water passing below the cap rock and discharging out into the ocean through those pathways. And I think our data very strongly validates that. Again, these are preliminary conclusions, but we think the data are very strong here. With that, I want to also credit the research team. Peter Canberg, Aaron Wallen are responsible for the geophysics, hydrogeology, Tumas Parat, Bob Whittier, Peter Pashut, and groundwater modeling, Tumas Parat, and Michael Friedel. Thank you.
Thank you, Don. Appreciate that. So let's jump right into our questions at this point. We're just a couple of minutes over time, but let's go with Ashley. You get your hand up first.
All right, I have a lot to say, so mostly to DOH, but I also have a question for Mr. Thomas. So please bear with me. This is going to be a lot. So first of all, can we go to the slide, indications PAHs originated from an alternative source?
Okay, so she's going to have to backtrack to that if you can.
Okay, well, in the meanwhile, I'll start talking.
But he may remember the slide. Could you say it again?
Indications PAHs originated from an alternative source.
Okay.
It says it's number 10.
Other factors that could be involved.
Yeah.
Do you remember the slide, Bob?
Yeah.
Yes, I remember that slide.
Yeah.
So maybe he can just answer it from his memory.
Yeah.
There it is right
okay,
here.
yeah, there you go. So I think that from my point of view, there are a lot of problems with the assertions from DOH that the PAHs originated from an alternative source, the entire presentation, because there is a fundamental problem, and the problem is there is missing information. So from this presentation, we know that we know what creates PAHs. We know the properties of a contaminant. We know the characteristics of it, right? We know how the contaminant interacts with the environment to a certain degree. But what we don't know, the big X in the equation, is that we don't know the behavior of the environment itself. I mean, nobody knows it. So that means when contaminants show up, the rate at which the flow goes, and where the flow goes. I mean, nobody has a big X-ray, and we know exactly where everything is going. So that's the fundamental problem with most of this. I don't have anything to say about numbers 1 and 5.
Okay.
But this fundamental problem affects numbers 2, 3, 4, and 6, because DOH seems pretty confident in their assertion that, you know, the PAHs come from other sources, likely sources, and I'll grant you that, you know, some sources are possibilities, but they're just that, possibilities. You cannot say with any absolute certainty that, you know, this is the reason why, you know, we were seeing PAHs in the water. I think some of the sources are more likely than others. For instance, I had a problem with the Aiea sugar mill because it was, the irrigation systems were active from 1901 to 1947 or something like that. I can't find the exact date in my notes, but why now? Why would it show up only now? I mean, we've had rain from 1947 to the current day, so why would it only show up in the samples being taken, you know, recently? And
Can I ask you to pause there? Because I think you have two questions, and maybe he can address them.
yeah, well,
Okay, so-
I mean, this is like one long question, and then the next.
Can we try to be direct with the questions?
Yeah.
So that will help get a direct answer.
Yeah, so the reason why I bring this up is the fundamental problem that we don't know the groundwater flow, we don't know the rate at which it goes, and we don't know where it is how can you say some things are more likely than other things to be the contamination sources when we don't know when a contaminant shows up? You know, we don't know the groundwater flow direction. And it says in number 2, BWS IAO wells have been shut off since 2021, so that it's unlikely for it to have shown up. But PFAS was detected in Halava Shaft in 2022 and 2024, despite having been shut down in December 2021. So obviously, there's still activity going on that we don't know about. So yeah, I was wondering if you could address.
So yeah, one of the challenges when you ask like 4 or 5 questions in one long sentence, it's hard to remember what they were. But if I can remember correctly, and you tell me if I'm wrong, you were saying there's not accounting for environmental factors, is that
Yes.
correct? Okay, so that's one.
Yeah.
And then the other one is why just now from, if it's the
Yeah.
sugar mill?
Yeah, like why
Okay.
is the IAS sugar mill like a,
Okay, so maybe you can
Specific.
address those 2, or if you can, and we can move on from there. Thank you.
We are about,
I had to turn it on and put it close to you. Yeah, it's a little,
maybe I turned it off by accident.
push it up hard, there you go.
Okay. We are evaluating environmental factors that we do know.
Try this one.
We are evaluating environmental factors that we do know, but you're right, there are a lot of unknowns. And we are continuing to look into those. We are working with the University of Hawaii to answer some of those unanswered questions. But, okay, one of the environmental factors I did bring up was the rainfall and recharge. I know a comment has been made where there's always rainfall, but in that period running up before the sampling, we had sustained moderate rainfall, which favors recharge, which would favor moving something from the surface down into the aquifer. But the why now question is one of those that we do ponder, and in our discussions yesterday, described a probability matrix we're working on. And we did give the Red Hill hypothesis a relatively green evaluation for that, because that why now did work well with Red Hill. It's about a little bit less than 2-mile travel distance, and it was like 3 years of travel time, not an unreasonable groundwater velocity. But also that why now got a green score for the residential fire, because that actually worked in. Others did not. But it's part of the evaluation. And there was another section.
Well, if we're able, because we got a lot of questions, I think Ernie, you probably have a few, and maybe Kathy, do you have a few as well? Okay, so maybe we can take those, you know, and I mean, I think basically, if I don't want to put words in your mouth, but you're basically saying not likely, less likely, blah, blah, blah. That is science at a certain point. You're trying to window around something. It doesn't, it's unsatisfactory if you're looking for certainty, but sometimes that's the best you can do and keep working. So if that's helpful, maybe you can talk more later on about some of the details.
okay, yeah, because because I'm sure everybody else has questions. And my second question to Mr. Thomas was, I think it's, can I ask it, or?
Well,
is it more-
it can be real quick and
Yeah.
direct. That would help.
Yeah. Yeah, and it may be a moot point anyway, because I know that everything is really preliminary, but Mr. Thomas, how does the UH groundwater model findings, preliminary findings, does it support one potential reason or another? Like, does it make some things more likely than others?
Well, yes, it does. Ultimately, what we hope to do is use our findings to develop a new numerical model that will show the most likely flow paths. And as I mentioned, the Navy model flow path was dictated very strongly by a single point of discharge over in the Pearl Harbor Springs, as they've been referred to, without any flow discharging through the cap rock or below the cap rock. And when we put that into the model, that will substantially change the computed groundwater flow directions. I can't see that it would not do that.
Okay. So it may sound to me, at least, that you don't yet have a model. You have some, you're going towards one, but you have some interim findings that can be informative for various analyses. That might help. Okay.
Thank you.
Kathy.
Thank you, Dr. Thomas. My question is, it seems that you're inferring, based on the studies, that the groundwater flow model goes from Mauka Mountain to Mackay Ocean. Is that what I'm hearing?
Yes, that's correct.
So is your well, so is it likely then that the PAH found at Aya Well did not come from Red Hill, based on the flow model?
Yes. Yeah, I think you're correct. It makes it very unlikely. Again, if our findings are sustained and the other data support, and in fact, that one well that I showed the direction of water flow for, it suggested that groundwater flow direction is actually opposite to what is shown in the Navy particle track computations. That water is actually flowing towards the southeast rather than towards the northwest, at least out towards Aiea and in that region in between Aiea and the Red Hill fuel system.
Okay. Maybe we can move to the next question. Ernie? And please speak close to the mic, because the Zoom people are having a hard time.
Can you, is this working?
It's the Zoom people
Okay.
that are having a harder time.
Thank you. To follow up on Kathy's question, Don, and nice to see you again. I really appreciate you referring to Dr. Chester Wentworth's work back in the 50s. You know, there were some really outstanding people at the Board of Water Supply, hydrogeologists that were like pioneers of their day in understanding the hydrogeology of our island. So thank you for referring to this report. I'd just like to point out too in this report, in figure one of the report, in the caption there, it says, you know, you talked earlier about some of the sedimentary erosional deposits like the valley fills serving as barriers. But in figure one of Chester Wentworth's report, this is back in 1951, he does note here, he has a map that shows the valley bottoms tongues, and it's stippled in the map, in the Honolulu section are known to be groundwater barriers. Those in the Pearl Harbor section, which are not stippled in this map, are apparently not effective groundwater barriers. So if you can take a look at that, you know, you mentioned how great work the Chester Wentworth did, and he did a lot of also boreholes around the valleys across Honolulu and to the Pearl Harbor area. And he didn't believe, according to this report, that valley fills were an effective barrier. That would be a barrier to flow across the valley from the Red Hill side to the Halawa side. So I guess I beg to differ, or I guess I want to see the actual more hard data, like more monitor wells drilled, especially in Halawa Valley and to the northwest of the Red Hill facility, which is something that I think we've all talked about for a while. Thanks. That's a question for Don actually more of a statement.
Please do.
And
You have to get a little
mahalo
closer
for-
to the mic,
Question
though.
in there.
Mahalo for recognizing Chester Wentworth. He was a great person. Thank you.
Okay, and next time, get a little closer to the mic.
Okay, I do have a question for Bob. You said that this, thank you, Bob, for following up to investigate where this pH might have come from that we detected in IAEA wells. And that was in our letter. Our letter requested that, can you look into this? So we appreciate it. You said that this was a preliminary investigation. What are other investigations that DOH is doing concerning these pH detections? And also, can you look at the use of surfactants at Red Hill and how those surfactants mobilize contaminants, especially those in the Vadel zone below the tanks, during its cleanup in 2021? That might have mobilized a variety of substances, including heavier weight PAH chemicals. Thank you.
Part of that would be a policy question, but the surfactants actually in our technical discussions have also been a concern because we did observe after the 2021 release the TPHO detections which were inconsistent with direct JP5 dissolution. So it is definitely being considered. I don't have any firm answers on specifically what will be done with that, though.
Are you going to look at the transport characteristics of PAHs that are changed when exposed to surfactants?
Could you repeat the question?
Uh,
Oh, sorry.
Are you going to look into the transport characteristic changes when they are exposed to surfactants?
Well, that has not been considered yet, to be totally honest with you.
And I guess you're looking at other sources of PAHs in the area, including sediments and other things. And could you help share some of that information with us too?
Right now, we're just doing the literature and the data analysis. I think any future work will depend on the future of pH detections.
Any thoughts, Bob, on the pH detections which also occurred in the Navy's monitor well NMW-24 near the old, you mentioned the IL Laundry facility. I think it's right across the street or in that area. What was the source of that too?
As with the pHs, we are doing the data review and looking at, and yes, we do know that particularly at, and somebody correct me if I'm wrong, but at the Navy's IAEA Halava shaft that there have been problems with PFAS.
Oh, PFAS. Yeah, definitely PFAS there too. I think from looking at a really old report on that laundry investigation that there may be some monitor wells that go down into the basal aquifer there. Maybe those will be good opportunities to take samples from if they're still available. I think some of the monitor wells were kind of shallow into the caprock. There might have been a few that were a little deeper into the basal aquifer in that area.
There were a limited number of basal aquifer wells put in, and the only one that may still be usable is MW16. The other two, which were up on the upper part of the facility, I believe have all been abandoned.
Yeah, thank you. Let's see.
Can we maybe go to this last question because we're getting a little bit behind time, and I know this dialogue will be continuing quite a lot.
Yeah, thank you. We want to continue that dialogue. Just one more question then. How does the DOH interpretation of groundwater flow to the northwest, which was, I guess, brought out in a 2019 letter from the Department of Health to the Navy, compared to the findings of the Navy's groundwater model report, which was recently, which has been submitted to the regulators, the EPA and DOH, but Board of Water Supply is still yet to see that report. We've only seen the 2020 report. How does groundwater flow in the latest report compare to that northwesterly flow direction that was raised, I think, by you, Bob, back in 2019. And also, I think when you were working for TEC Tech
Yes.
back in 2010 or so, I think you wrote a memo on that to that effect, based on water level data in the area.
Right. And I have long expressed concern about flow to the northwest, primarily because of the Halava shaft. My concern was that if there was a catastrophic release, you could get the fuel product banking up against the contact between the valley fill and the basalt, and then it could turn that corner around the upper toe of that valley fill wedge and go to the Halava shaft, which I kept stressing would be a catastrophic result. Now we are in a new phase of research, which hopefully will reconcile all the differences that we have between the Navy model, between the USGS, Malcolm Mackay, between, as you point out, my own postulated northwest flow. So I think at this point, we wait for the data to come in.
Yeah, I guess my recommendation would be actually, let's drill some monitor wells further up in the valley, South and North Fork, and try to get more data on that northwesterly flow. And perhaps PFAS, which is more water soluble and persists in the environment, might effectively become a tracer.
Not all that I can comment on, but I do know that we are, well, not we, the Navy, with our assistance, is diligently working, trying to get critical wells put in between Red Hill and Halava, because for that very reason, we need to monitor that flow path.
Yeah, and just a last comment this is for the community and the viewers. Ashley mentioned that we are now seeing PFAS detections in our Halava shaft, which is shut off. And we're taking the samples actually at the pool of water that people would see when they went down into Halava shaft and looked through the window. And since we had a detection 2022 December, and now we consistently are detecting at least 2 types of PFAS chemicals in our Halava shaft.
Okay, so that was the last comment, so thank you, and we can move along to the next one. I'd like to ask the next group of panelists to start making your way up, because we got a little bit of dead time here. Thank you, Bob. Thank you, Don, for everything. We're slightly still behind time due to a few things, but kind of anticipated. Our next panel is going to feature 3 speakers on various aspects of drinking water, and they'll do some self-introductions when they're up here. We'll try to we're going to move through all 3 as a group, and then go back to the FTAC members for questions and comments. No problem. And if any of you are planning to present while sitting down, you should take either the middle or the far right side so you're much more visible. If you're going to stand up, the floor is yours. So let's go first with Paul Winkler, who is going to provide a review of the Navy Tech memorandum regarding TPH detections.
Thank you, Keith. My name's Paul Winkler. I am one of 2 analytical chemistry consultants hired by BWS to provide a technical evaluation of the SWARM team's technical memo. The other group of people that helped evaluate this are behind me, Allison Felix and Jeannie Peterson. They represent a different analytical chemistry consultant.
You cut off. We have lots of sound gremlins today.
Yeah. Okay. So what BWS did is they hired 2 different analytical chemistry consultants and had both of us review this data independently without the knowledge of anyone being there, so then they could compare our conclusions. After that period, we came together and we looked at the conclusions that we had, and we are now going to make a few comments about things that we observed about the swarm team's technical memo. So if I can have the next slide, please. These points are not in any particular order of priority. They just happen to be where we put them in the presentation. The first thing is that it seems that the Navy swarm team assumed that the flush of the Red Hill shaft was 100% effective. If this is true, then if we have an increase of TPH detections, then it must be due to an analytical method. And that's certainly what the swarm team found. But they didn't discuss things like sampling and intermediate points in the system. They didn't talk about what effect maybe discharging this water into fields might be. They didn't consider, was there contamination at the point of sampling, for example? So there are some things that we feel that probably could have been considered that weren't. Have the next slide, please. One of the points that the swarm team made was that all of the different zones had the same TPH detection pattern. So I went and I looked at some patterns, and what we have here on the top is zone H1, and on the bottom is zone F2. In particular, you can see that these two patterns are not the same. So it is my conclusion that each different zone had a different pattern. The thing is, if the patterns were the same, then we could argue that it's a problem just solely with the lab. In particular, right in the middle of the graph is LTM6. In the upper graph, we see a pretty consistent level of TPH detections. On the bottom, this method looks great until about halfway through LTM6, and then all of a sudden we start seeing an increase in TPH detections. So at a similar sampling period, LTM6, where the laboratory is analyzing these samples at the same time, we're seeing a very different pattern of detections. Next slide, please. Point number 3. What we do know, and I think this is widely recognized, is the sample preservation procedures were not followed correctly. So they put hydrochloric acid in. Hydrochloric acid is not required for DROs, and it's only used as an antimicrobial preservative for other types of analysis. Secondly, maybe most importantly, this is a drinking water sample. Drinking water samples have residual chlorine. Residual chlorine must be removed because it is known that they will react with chemicals that are in the water. This critical preservation step was not taken. And as we'll talk a little bit later on, this can cause some real problems with interpreting and using the data. Point number 4. So the method that was used is an old EPA method, and it's used for relatively high levels of total petroleum hydrocarbons. What we're looking at here are detections in the range of 50 parts per billion. So we have an analytical method that is designed for very high concentrations from 50 parts per billion to 10%. And we're all kind of haggling over here on these relatively low-level detections. Well, the method wasn't adjusted to give us accurate quantitation. Some things that you need to do when you're doing trace analysis in the laboratory is you need to have dedicated glassware. You'd like to have a dedicated instrument, and you adjust your calibration range to be more appropriate for the level that you're working with. The EPA, in fact, recommends that you make method modifications to meet the requirements of the project. These changes were not made to method 8015 and can result in some issues with low-level quantitation accuracy. Next slide, please. And point number 5, one of the things that we saw from time to time were that we had samples where a process called clipping was engaged. What clipping means, we have this pattern, we have a certain area of this pattern, and then we change where the baseline is. We change how we're looking at the data, and this can affect the raw area of the peaks. We saw many, many instances where there were peak clipping. The problem with peak clipping is it makes it very difficult for us to assess if we have a non-detect for TPH, was it really non-detect, or did they move the baseline up and remove some area and put it below the detection? These are small differences. It's not like we're going to miss a massive amount of TPH, to be clear, but it made it very difficult for us to be able to evaluate the accuracy of a lot of TPH detects and non-detects. The next slide, please. Point number 6. In the swarm team's memo, they found 2 main reasons for the increased TPH detection. One was chlorination of a surrogate. 2 was blank contamination. So point number 6 here relates to the surrogate. The surrogate, in fact, does react with chlorine, absolutely. but it was present at the same concentration throughout the entire sampling period. So for the first year and a half, the existing method worked fine. TPH detections were low, and suddenly they cropped up. If chlorination of the surrogate was a problem, we should have expected to see this level of detections the entire time because the chemistry is consistent. And another point then the SWARM team made was that the detections of TPH correlated with the concentration of chlorine. We did not find this. I plotted TPH detections against concentration of residual chlorine in the samples, and in fact, the second highest level of detections really occurred at the lowest concentration of chlorine. So I don't believe that we can correlate an increased detection of TPHs to the chlorine level. We did not see that correlation. Point number 7, some of the peaks attributed to the presence of chlorine were in the method blanks. So in the SWARM method, SWARM team technical memo, they found about 4 or 5 peaks, and they said these were brominated surrogate compounds. In fact, several of those peaks were present in the blank. Blank is not chlorinated, so those peaks cannot be from a halogenation reaction with the surrogate. So we were a little bit concerned about what really the identification of those were. Also, in the memo, they noted these compounds were brominated and not chlorinated. So we feel like maybe a little bit more detail and information needs to be provided there. Point number 8. We did want to emphasize that even when we do have blank contamination, that is not an indication that there's no TPH in the sample. It is possible to have a contaminated blank. Labs occasionally do contaminate blanks, but that doesn't mean that there is no TPH. So if we see some samples that are associated with a contaminated blank, there still could be TPH in those samples. Next slide, please. Point number 9. In this graph, on the very bottom, we have a dotted orange line. Those are the results from the method blank. When you prepare samples in an analytical laboratory, you have a method blank that you prepare that you know is free of analyte. And then you usually prepare up to 20 samples with it. And so the results on the bottom, the dotted orange line, are showing that we have no TPH in our method blanks. Up above, the blue line shows for those samples associated with the method blanks below that we have TPH detects in those samples. They're low level, they're between the method detection limit, or how low of a concentration can be detected by the method, and in some cases they're actually above the reporting limit where the lab is comfortable reporting those numbers. The point is, for a large portion of these 66 samples that we looked at for this particular zone, the blanks are clean. If we had a problem with method blank contamination caused a sudden rise in TPH detections, we should have seen an increase in the blanks, but we did not see that. So we don't feel like the data supports method blank contamination as a problem for the increased detection of TPHs. We think there are probably some other factors may be affecting this. Next slide, please. Point number 10. One of the things that could be occurring here is we might be contaminating the sample at the point of collection. One of the ways that you monitor for that is by testing for field blanks, and that is where you take a sample that's clean, you create it in the field through all of your sampling apparatus, and then you show that the act of sampling doesn't contaminate your sample. Field blanks for this analysis were not collected, so we could not evaluate whether or not samples are being contaminated during the point of collection. Point number 11, in the SWARM team's technical memo, they said, look, there are marker compounds in JP5, and there are, but they didn't see them when they looked for them in one of the analyses. The concern that we have about that is we're talking about very low levels of TPH and even lower levels of the marker compounds. Again, analytical methods have a certain concentration that when it's below that, you just can't detect them. And we are concerned that the marker compounds might actually been below the method detection limit that they used to look for them. So if you don't see them, it doesn't mean they're not there. It just means that it was too low of a concentration to see. So the second thing is they were analyzed from different aliquots. So we have one method called 525, another method called 8015. We collect those samples in 2 different bottles. It could be while you're collecting in one sample bottle versus another, one happened to have some TPH and maybe one didn't. And the way that you handle those extracts and analyze them are different. So there's some differences there. and we don't think that you can draw a conclusion from the lack of marker compounds in the sample. Point number 12. So we know that chlorine was not removed from the samples when we took the sample, and then we go ahead and we prep it. What we don't know, and there's very limited data on this, if you have TPH in your water sample and you have residual chlorine, we don't know how that chlorine will react with the residual TPH. We do know it reacts with certain chemicals. That's one of the reasons in the drinking water method, you have to remove residual chlorine. So for a wide range of organic chemicals, it is known that chlorine reacts with these chemicals. Because the water was not dechlorinated, and because we do not know how low-level organic compounds like TPH might react with the chlorine, we can't say for certain that these results are reliable. It could be that TPH reacts with chlorine and then we didn't see it. It could be it doesn't react at all. We don't know, and that's the problem. Because you don't know, you can't make any real statement about the validity of the data, which we'll get to in a little bit. Point number 13, in the SWARM team's memo, they developed a new method called the MEQ, which is a microextraction method. And you know, this method has some pretty good things. It dechlorinates samples, and but the problem is it changes the extraction of the method. In normal 80-15, we're doing 1,000 to 1 concentration. In the MEQ, we're only doing 25 to 1. So a significantly different amount of concentration of the sample. We're not sure that the two data sets would be comparable. In the data we had available to us, which is what is available to the public, we didn't see enough information to be able to draw any conclusions about comparability of the data sets. Also, from my calculations anyway, we're putting a whole lot more material onto the instrument with the 80-15 sample preparation than we are with the MEQ preparation. And it's not clear to me, having not seen the MDL study, that these two MDLs could be comparable because of the significant differences in the sample prep. Next slide, please. So those were the things that we saw in the technical memo. We were also asked to say, well, you know, if you had to evaluate this for method compliance and defensibility, what would you say? Well, we know that these samples were not collected and preserved in following EPA recommendations. That alone makes this data technically not compliant. So it means that the method was not followed as required. And the reason that you have these kind of guidelines is because we know if you don't follow them, you can have problems with the data. Because things weren't dechlorinated, we also don't think that you could defend really the data. Because we don't know how chlorine reacts with TPH, we need to have more understanding what happens there before you can make really any comment about the data. Finally, point number 3, and this will be my last point, the existing data was found to be suspect because of the problems that I outlined. Because of that, for the purposes of proving the absence of TPH, we don't feel that you can use this data because you don't know how chlorine reacts with TPH. And we're concerned with that lack of knowledge. So that was the things that we found when we reviewed the TPH data. And again, I would point out that we came to this independently, even though I'm giving the presentation. Thank you, Keith. That's it.
Great. Thank you, Paul. So if you have a seat, and then we'll have Admiral come out. And do you want to use the wireless and walk out, or you want to just do it from there? Okay.
Can you hear me?
Move it closer to you. The microphones are a little soft here, so you really need to have it very close. You want to use the handheld?
I got it.
All right.
Is that good?
Better.
A little bit closer? All right. So, hey, good afternoon. I'm Rear Admiral Mark Williams, the Deputy Commander for the Naval Closure Task Force, and with me is Commander Ben Dunn, who is our environmental team lead. As we've transitioned successfully from defueling the facility significantly ahead of schedule, moving on to our decommissioning and our environmental remediation lines of effort, I want to reiterate the Navy's commitment to protect the Hawaii's aquifer for future generations as well as for today. Next slide, please. So I think it's important we level set here on what has occurred and what is occurring with regards to the Joint Base Drinking Water System. So in the wake of the November 21 water crisis, the Interagency Drinking Water System Team, also known as IDWST, was established and was comprised of members and subject matter experts of the Department of Defense, Department of Health, and the Environmental Protection Agency. And they were tasked with designing a process and a program to bring the water system back online and to continue to monitor that system to ensure that it was delivering safe and reliable drinking water. That monitoring program that was developed was the long-term monitoring program, also known as LTM, which Dr. Winkler just talked about. The point of the LTM program was not to detect or prove the existence or disprove the existence of TPH. It was designed to prove that the system had fully recovered and did not contain jet fuel. With regards to the comments you just heard, next slide, please. I'm sorry, previous slide. The Navy stands 100% behind the findings of our swarm team and the tech memo. We stand behind the validity of the long-term monitoring sampling results. And it is important to note that that sampling plan, the sampling design, was designed, approved, and executed under the authorities and under the oversight of the Environmental Protection Agency, as well as the Department of Health. While we are not going to review the BWS consultants' comments and assumptions on a point-by-point basis here at this forum, I do invite an opportunity to sit down with the subject experts, to sit down with our swarm team members to discuss fully so the full context can be understood and all the assumptions and so forth. That said, there's two things I would be remiss, and they were the two up front on the slides that are factually inaccurate that I need to correct here for the record. The first is the statement that the swarm team assumed the flush of the Red Hill shaft was 100% effective. The Red Hill shaft was not flushed. It was disconnected from the system altogether. The second thing is the incorrect statement that the swarm, quote, the swarm team did not discuss sampling intermediate points in the system or the discharge of untreated and contaminated water to open grassy areas. The ground truth on this is that IDWST followed a methodical and data-driven approach. A step-by-step process was followed with Department of Health and the EPA in oversight, including split sampling. We started flushing with the mains, the laterals, and then finally all the buildings and the residences. Confirmation sampling was required after each step, and the results were shared with the public on the Safe Waters website and remain there today. There were no assumptions made. That said, the bottom line up front is this. All the information, including the swarm team's findings and the Department of Health's independent evaluation, indicate that the 9,200 samples that were collected during long-term monitoring are valid, and there continues to be no indication of petroleum products, i.e. JP5, in the Joint Base Water drinking water system. And furthermore, as you'll hear here on the extended drinking water monitoring program, it continues to be with over 3,500 samples taken to date under that monitoring program. So with that, Commander Dunn is going to talk you through the LTM results and then introduce EDWM.
All right, aloha, and thank you, sir. I'm Commander Ben Dunn. I'm the Deputy for Environment and Remediation at the Closure Task Force, Red Hill. And first, I'd like to just thank you all for the opportunity to speak today and to provide some updates and progress on where we're at. At first, I'm going to overview the drinking water program, so the recent long-term monitoring program and then the current extended drinking water monitoring program. So next slide, please. The drinking water long-term monitoring program, as the Admiral mentioned, was developed by the Interagency Drinking Water Systems Team, which is a body of subject matter experts and representatives and officials from the Navy, the Army, the DOH, and the EPA, which convened to design this unique program. The 24-month program began after the completion of the zone-by-zone flushing and Department of Health certification that each zone was safe to proceed with water provision and consumption. The plan included an analysis of normal drinking water analytes, fuel-related products, metals, and petroleum hydrocarbons, all established by EPA, all collected and analyzed by EPA methods. It was conducted in addition to our normal Safe Drinking Water Act compliance efforts. The sampling was conducted, as you can see here, over 7 periods for 24 months across the 19 zones established of the Joint Base Distribution System. The plan estimated to collect about 7,800 samples, taken from 2/3 of the homes, from the Waiawa source water, across the distribution system at hydrants, and then at priority locations of schools, CDCs, clinics, and child development homes.
If you could please keep good in the mic, because the Zoom people have a harder time hearing than in the house.
Thank you, Keith. During this time, the Joint Base Distribution System was served only by the Wyava source, which is located 6 miles from Red Hill. Next slide, please. So the results from our LTM program, just to overview that, the plan concluded on schedule at the end of March of 2024 this year and collected over 9,200 samples, so well over the 7,800 that were planned. All collected and analyzed with oversight by EPA and DOH in close coordination. And the main finding here is that we did not detect any fuel or JP5 in the distribution system through this program. In period 6, during an increased trend of petroleum hydrocarbon detections, the Navy swarmed this issue, brought experts from multiple agencies across the country together to conduct a root cause analysis, much like the IDWST was formed to establish this program, to attack and get to the bottom of what we were seeing. In February 2024, shortly after the Navy's root cause analysis, Department of Health collected samples independently, ran an independent investigation, and released their findings several months later, also confirming no detection of fuel or petroleum found in the drinking water system. Our results from the drinking water LTM program are located on our Safe Waters website, and they have been updated month by month. And we communicated results to each zone and the community through our information, drinking water information booths, which we continue today. Next slide. Just to reiterate, the results collected across the LTM, first, every method was again collected via established protocols and analyzed by an independent EPA certified laboratory, and all of the results are valid. We have significant empirical data supporting our conclusions that are presented in the swarm check memo and the data that is available online. For the extended drinking water monitoring program, again, this is our current enhanced drinking water monitoring oversight effort. This began back in April, immediately following the conclusion of the long-term monitoring plan. This is a 12-month program that the Navy voluntarily initiated to deliver on its commitment to continue monitoring the system, ultimately to verify that the system has recovered and remains safe, continuing to meet federal and state standards. Objectives of this plan include the goal of sampling every residence served by the Joint Base Distribution System. So 2/3 collected during the 2 years of LTM. We're looking to get to the balance of the residences through the end of the extended drinking water monitoring program. It also focused on fuel-related analytes and applying an investigatory approach and, in some instances, a more advanced analysis. Aspects of the plan include an additional sampling zone for the Manana housing in Pearl City, additional fuel indicator compounds that are added to the analyte list, increased frequency of priority areas. So during LTM, we sampled each school, CDC, clinic, and the Wyava source during each period. We're doing that today every month.
If we could kind of try to wrap up, because we have one more presentation to go. Thank you.
And the program's also executed in conjunction with our Water Quality Action Team, which is a comprehensive response capability to water concerns that the Navy expanded back in April as well. The results from this program are also available, updated monthly on the Safe Waters website. Sir?
Yeah, so next slide. So with this is the side-by-side showing what we did during the long-term monitoring, what we're now doing during EDWM. You'll see that where an LTM tested for a broad scope of analytes, we're targeting additional fuel indicator compounds under the method 525.2 at the bottom right. The other thing I do want to call out is the significant difference. So you'll see 8015 under LTM, again, was run as designed and directed. I do want to call out, because Dr. Winkler, I think we reached the same conclusion, or the swarm team reached the same conclusion. So I don't want to misquote you here, sorry. right? That the 80-15, therefore at a minimum, adding, when you're talking about the 80-15 method, therefore at a minimum, adding a thiosulfate step to the existing procedure in accordance with the SW 846 guidelines and lowering the surrogate concentration to a lower concentration are the good practices analytically and will improve the ability of the method to detect, again, I'll reiterate, and will improve the ability of the method to detect TPH in the sample, correct? Okay. All right, and I think the SWARM team reached the same thing, same conclusion, and that's the important thing to note here is that during EDWM, the 80-15 method under EDWM is being run in full compliance or in full alignment with what Dr. Winkler's talked about and what the SWARM team reached. So with that, Ben's going to talk about the results received to date.
Next slide, please. So in finality for our extended drinking water monitoring program, 6 months in, the Navy's collected well over 3,500 samples by today with only 9 detections of total petroleum hydrocarbons, no fuel detected through our analysis. The results obtained by the Navy are reinforced by split sampling results collected and analyzed by the EPA. Additionally, the EPA has conducted a recent audit to ensure our sampling procedures are up to spec, and no significant findings were annotated. Sir.
So before we go to the next slide, so almost all of those TPH detections end up being food-grade lubrication. So think of like vegetable oil at hydrants. So next slide. So just in closing, right, we know it's important. The public's interested in we want ongoing community engagement and data sharing. So here are some URL codes with various resources to get up to date on engagement opportunities, our data pertaining to our efforts and the information. And again, I want to reiterate and reinforce, right, the data and the samples collected during LTM as well as EDWM are fully valid and can continue to demonstrate that the system has recovered and remains recovered from the November 21 event. Thank you.
Okay, thank you very much. Claudia, do you prefer to sit there or you want to use a wireless?
I'll just sit here.
Okay, if you could move that real close to your mouth, because even though you can hear yourself in the room, the Zoom people have a bigger issue with the audio.
Okay. Great. Hi, my name is Claudia Espinoza. I'm an environmental engineer with EPA Region 9's Drinking Water Section, and I'm the Red Hill Drinking Water Lead. So today I'm going to be going over general drinking water updates on the completed and upcoming oversight activities that we have done for the Red Hill drinking water systems, as well as addressing some of the raised concerns around the TPH monitoring during the Navy's long-term monitoring program. Next slide, please. So just to kind of go back again, on March 18, 2022, the Hawaii Department of Health made the final amendment to the Public Health Advisory issued on November 29, 2021, to clear all 19 zones in Manana housing and declare the water in these areas safe to drink. The Drinking Water Long-Term Monitoring Plan for the Joint Base Pearl Harbor Hickam and the Aliamanu Military Reservation water systems was developed by the Navy and Army as a long-term approach to monitor the water systems following the removal of the Public Health Advisory. This plan was approved by DOH and acknowledged by EPA on June 16, 2022. The long-term monitoring plan was intended as a surveillance tool to ensure the Joint Base Pearl Harbor system and AMR systems were free of petroleum and response byproduct contamination over the course of 2 years. For this special investigation, samples were collected to analyze for over 40 individual compounds in bulk chemical measurements. You saw that earlier by the slides presented by the Navy. One of these bulk measurements was for TPH, and that's what we're talking about here. I want to make that clear. There has been some statements around, the entire program. We're not talking about anything but TPH right now. So just want to make that clarification. Total petroleum hydrocarbons is a term used for the broad category of mixtures of chemicals that derive from crude oil. TPH is not regulated under the Safe Drinking Water Act. EPA methods 8015 and 8260 are common analytical methods for determining the concentration of TPH in soil and groundwater. 8015 and 8260 are not drinking water methods. However, they were used as part of this special investigation in both the emergency response and in LTM to screen for potential petroleum products that may have impacted the drinking water systems following the November 2021 release. In LTM, EPA method 2660 was used specifically to measure the gasoline range organics, and method 8015 was used to measure the diesel and oil range organics. In addition, in LTM, the project-specific screening level for TPH was established as 266 micrograms per liter, meaning that the Navy would engage in specific corrective actions as outlined in the plan if there were detections identified above this screening level. Before I move on to the next slide, I would like to point out the graph on the bottom right-hand side. This shows a depiction of different constituents in the TPH range. As you can see, there's many different types. This is a mixture in a broad range category. Next slide. So what did we learn from the data collected throughout the course of LTM? The data observed suggests no presence of JP5 in the Joint Base Pearl Harbor Hickam and AMR drinking water systems. Again, that was the objective of LTM, was to look for JP5 in these water systems, not broadly for TPH. I want to make that clarification again. Any detections above the LTM screening levels were addressed through course of actions as outlined in the LTM plan. After this long-term approach showed that the drinking water systems remained safe following the lift of the Public Water Health Advisory of March 18, 2022. The data also showed us that there was an increased occurrence of total TPH concentrations above the screening level, most notably during the periods 6 and 7 of LTM, and that's what we were discussing earlier. And as was mentioned earlier, on January 30th, 2024, the Navy did develop a sworn team to investigate in the root cause of these uptick TPH detections. EPA and DOH participated in about 5 sworn meetings that occurred between January 30th and February 7th. In this review, several factors were considered. I'm just going to name a few. Test methods used for TPH analysis, side-by-side comparisons of the TPH test results using different sample preparation methods, the presence or absence of other JP5 fuel indicator compounds, dataset reviews of the chromatograms, and changes in the operations of the drinking water system, such as changes in the disinfection treatment. For EPA, the strongest line of evidence was that our technical staff verified the absence of JP5 or fuel patterns in the chromatograms for these TPH detections. Earlier, we heard that the data was unusable for the purposes of providing the absence of TPH in the drinking water system, and we fundamentally disagree. Again, we were looking for JP5, not TPH as a whole. This was related to a special investigation for the release of JP5. And it's usable for that purposes because we looked at evidence and did not find any JP5. In the graphs to your right, you can see that there's an example of a typical fuel fingerprint pattern at the top, and at the bottom, what was seen typically when evaluating the chromatograms of these elevated TPH detections. This is kind of what our experts were looking at for this fingerprint analysis. JP5 or fuels have a very distinctive look, and when you don't see that, that's how you can verify if there actually is a fuel pattern. And this was done for these high-level detections. In addition, as you heard earlier, DOH also performed an independent forensic analysis investigation and found no petroleum or jet fuel compounds that were detected as well. Nonetheless, there were a lot of lessons learned during LTM, and following these sworn discussions, as again was said earlier, we all felt there was a need for more data, and EPA specifically wanted to see more data in order to verify and support the Navy's conclusions in the TAC memo. And that's where we go to extended drinking water monitoring. So the Navy's extended drinking water monitoring plan began in April 2024, following the end of LTM, and captured many lessons learned. Next slide, please. So at the last FTAC meeting in April earlier this year, many of these same concerns came up, and both EPA, DOH, and the Navy were here presenting these concerns to everyone in this audience as well. And we had a similar slide here with specific actions that EPA was committed to taking to address the water quality concerns related to these elevated TPH detections during LTM. I'm happy to share today that since the last FTAC meeting, all of these actions that we committed to taking have been completed, and I'll go over briefly what was accomplished. As I mentioned earlier, EPA reviewed the chromatograms or fingerprint analysis of these high-level TPH detections during LTM and found the patterns do not resemble JP5 or other petroleum fuels. Further data set reviews are also being conducted as well with the new data that's currently being collected from EDWM. EPA also committed to collecting and analyzing split samples. During EDWM, EPA is performing independent split sample analysis for up to 5% of drinking water samples collected by the Navy under EDWM. Next, EPA is also committed to conducting an independent inspection. EPA did complete this independent inspection on June 2024 to evaluate the Joint Base Pearl Harbor Hickam and AMR water systems. EPA also committed to require the Navy to continue sampling and tested. As mentioned earlier, at the end of LTM, the Navy began sampling and testing under EDWM, taking into consideration the lessons learned from LTM and committing to sampling 100% of the residences in the impacted zones, as well as Manana housing. Furthermore, EPA wanted to identify new analytes to add for future testing. As part of EDWM, we had requested the Navy to add 16 new analytes that were associated to fuel that can help act as indicators of potential petroleum contamination in the drinking water. And finally, EPA committed to engaging with our Office of Regional Development, Research and Development, and our agency partners in ATSCR to better understand health-based risks for potentially unregulated constituents that may be found following deep dive forensic analysis. Next slide. So similar to the last FTAC meeting, we want to make new commitments to continue the special investigation for the Joint Base Pearl Harbor Hickam system and AMR system to demonstrate that there is no JP5 in the drinking water. These include getting the EDWM plan finalized and approved by EPA. In addition, getting EDWM into the scope of work for the 2023 Administrative Consent Order. EPA is also committed to share our split sample data, and our public viewing dashboard is almost ready to go live. Our Region 9 laboratory is also performing a special study of chlorine interactions with the OTP surrogate that was used by the Navy to see if they can recreate the false peaks that were observed during LTM. And as mentioned earlier, the June 2024 inspection was completed, and the final report will be available very soon, possibly as early as next week. And the final report for the September 2024 sampling audit will also be available and posted in the near future. Next slide. So this concludes EPA's drinking water updates presentation. For a copy of the final drinking water inspection reports, including the June 2024 inspection and the audit findings, once they are published, please look at our website listed here. In addition, for other information related to the Red Hill bulk fuel storage facility and EPA's work related to that, please visit our Red Hill website. And if you have any questions related to EPA's work on Red Hill, please submit your questions to redhill@epa.gov.
Okay, thank you very much, Claudia. Okay, so I'm sure we're going to have a lot of questions. One real suggestion, let's be real clear and direct. A direct question will give you the best chance for a clear answer. Ashley.
Okay, my first question is to the Navy, and then I have a follow-up question for EPA and DOH to answer. So to the Navy, during long-term monitoring, you said you tested extensively for metals and other contaminants, and you posit that the water is safe to drink. Is that correct?
That is correct.
Okay, then if that's the case, why were there detections of lead from homes served by the Joint Base Pearl Harbor Hickam water system, which were collected under the long-term monitoring plan?
So correct, there were detections of lead throughout the LTM and 3DWM. There's detections of lead under the lead and copper rule and our compliance monitoring. With regards to the exceedances during LTM, those exceedances were immediately cleared. We went through a process where we communicated directly with the Department of Health and the EPA. We cleared the residences. Again, I want to reiterate, we're testing inside of the house. No other water purveyor in the United States goes to your kitchen sink and tests. Okay. We're testing there, so every one of those was a fixture. We cleared it, we flushed it. right? Resampled, the house was cleared, and all that was all done within 24 hours.
Okay, thank you. And then my second question is to the EPA and DOH. This is regarding the Board of Water Supply letter dated August 29th, 2024 to EPA and DOH. It said, I'm just going to briefly read a small portion of it. It says, at the August 26, 2024 Board of Water Supply Board of Directors meeting, a testifier presented the enclosed data showing levels of lead detected from homes served by the Joint Base Pearl Harbor Hickam water system collected under the long-term monitoring plan. The data shows a number of homes with lead in tap water levels that exceed the lead and copper rules 15 UG/L action level for lead. We request that the Environmental Protection Agency, EPA, and the Hawaii State Department of Health, DOH, comment on the findings based on the current lead and copper rule regulations and your instructions to the residents served by the JBPHH water system. So the letter goes on to urge a response from EPA and DOH to the testifier, who is Miss Susan Piccola Davis, and to BWS. So I could have missed something. I didn't have a chance to look extensively, but what was your reaction or your response to that testimony?
So our response is actually, we did a presentation at the last CRI meeting. It was intended to be 45 minutes. It ended up being almost 2 hours, specifically on lead. And the testifier was there present, and she actually came by at our open house yesterday and thanked us for that presentation on lead because we answered all of the questions and gave a thorough explanation of lead. I want to iterate that lead does not have a MCL.
Okay.
The 15 ppb is an action level. It is not MCL, and it was used during LTM and is still being used in DWM as a screening measurement.
Gotcha. Thank you for clarifying.
Okay. Any other questions? Got two. Dr. Lau, you're up.
Okay. I listened to all of you, and I noticed at least this table, I don't know what you want to call it, the colorful one.
This is the table you're referring to?
Yes, that's the one.
Okay.
Because you at least agree on the methods of how you're going to look at each of the contaminants. And I encourage all of you to continue that, the EPA, the Navy, and the consultants, because it's a lot and it's confusing for a lot of people, and I was getting very discouraged that we are all fighting each other, but actually we all have the same goal. We all want everything to be safe for us and our children. So thank you for at least trying to work together and finding a method that is going to work. Number two, I came with a slide with this one. You can find this one.
Slide 2.
Yeah, this is the Navy slide. It's very nice, it's very slick, it does tell us a lot, but I've taken issue with kind of whitewashing what happened. The first one, emergency response to Red Hill watch them with inadvertent strikes the drain valve. What doesn't get said is it inadvertently strikes a drain valve that was sagging because it was made of PVC instead of steel and was being weighed down by 19,000 gallons of JP5 fuel that was unaccounted for after the May 2021 release. This is how it all started. And so it's misleading to whitewash it with just a statement that it was struck. The other two, the next two bullet points are together at the same time, December 21 to March 2022. Okay, fine, the flushing was done by opening fire hydrants and pipes from homes onto open grassy areas, allowing this potentially contaminated water to seep into the ground and so into the groundwater as well as the sewers and drains. That is also not noted in here. The fourth one, drinking water and long-term monitoring, maybe collected over 9,000 samples. That sounds great, but at the last MTAC meeting, like you all just said, 8,000 of those samples were incorrect.
Dr. Lau, we hear that the Zoom people can't hear you at all. The tech people are feverishly trying to fix your mic. If you could have another mic brought over. Here, let's try this one. Whoa, that doesn't help. Try this on, turn it off. Yeah. Well, if you could condense it as much as possible.
On?
Yes, it's on.
Can we try this again? Okay. First one that I want to mention was, whoops, this colorful slide that you guys all can, and what I was trying to do was commend all of you for working together. Because, well, I can't say it all the same again as with the same passion I did earlier. But basically, it's nice to see the three of you working together, the Navy, the EPA, the DOH, and our consultants, because at least you at least agree on a method of testing each of these things. But the other thing I had the more issue with, and I hope you actually continue to do that, to collaborate instead of working against each other. The other one is this, yes, thank you, has the 5 points that Navy has said they have done. Okay, so the first one is emergency response, November 2021 to December. It notes that a Red Hill watch standard inadvertently strikes a drain valve, but it doesn't note that it was sagging because it was made of PVC instead of steel and was being weighed down by 19,000 gallons of JP5 fuel that was unaccounted for after the May 2021 release. This pipe was also supposed to contain water as it was a fire suppression drain line, but instead it unknowingly contained fuel, which could have actually made a fire worse. So I don't agree with the whitewashing of data and facts that has happened before. Items 2 and 3, the idea of WST and the drinking water system was flushed. The flushing was done by opening the fire hydrants and pipes from homes onto open grassy areas, allowing this potentially contaminated water to seep into the ground and so enter the groundwater as well as sewers and drains. Item 4, drinking water long-term monitoring. The Navy collected over 9,000 samples is what you write here, but you also deemed it inaccurate at the most recent FTAC meeting because the testing protocol was not followed, which both of you agreed to today. Actually, all 3 of you agreed. The last point, the extended drinking water monitoring point, is March 2024 to present, but it's also going to end March 2025, and it's, as you highlight, the Navy voluntarily implemented this EDWM, and is scheduled to end in March of 2025. So the Navy could also voluntarily end this monitoring in 5 months, and does that make the residents feel safe? I'm hoping, EPA, you just brought up this point today that you're gonna try to get it in an administrative order and consent. That would be great. I hope Navy will also continue to do it, and I hope they actually agree to the AOC because that will live on forever, hopefully. The remediation effort is gonna take us decades. We're gonna find out about the health effects over decades. We need to have this project continue, and that is my plea to all of you, is to please continue working together, because obviously you can, because you agree on these data points at least. Can we try to agree on some other things as well? Thank you.
Okay, if anybody has a response, great, and then we'll move to the next question. Thank you.
Yes,
turn your mic on. Thank you.
Can you hear me? Yeah. Dr. Lau, thank you for expressing that feedback and sharing your comments. This graphic here was designed to provide a very summary overview for context as to the sequence of drinking water monitoring programs. That was all. The Navy's not discrediting or discounting the situation that it caused and the responsibility it has to the community and to the community of Hawaii to recover the environment. There were many lessons learned from long-term monitoring, which the EPA highlighted, which we have tucked into the extended drinking water monitoring program. That other graphic kind of highlights that there's a lot of similarities, but there's some differences in the EDWM, and that was through very close coordination and ongoing discussions with DOH and EPA today about the extended drinking water monitoring program. The Navy did initiated that program to deliver on its commitment. It's the right thing to do to continue monitoring, and that's what we're doing. Working with the EPA about the ACO integration. And another lesson learned about the one method that we applied, the micro-extraction quenching method that we tucked into the extended drinking water monitoring program. We used large volume injection in that method to achieve a very low, much lower method detection limit, which is more helpful to detect petroleum hydrocarbons and advance our analysis. Well, thank you very much.
Okay, thank you. Ernie, you have a question?
Thank you. I have a number of questions. Maybe starting with the Navy. Admiral, Williams, thank you. We look forward to actually the opportunity to sit down with your swarm team experts, Chris Waldron, or whoever you want to bring, with our experts that we've employed to do a peer review of your LTM.
Yeah, we'll work offline and figure out times that work for everybody.
Yeah, we're also, just for information, we're looking at the Extended Drinking Water Monitoring, EWM.
Really easy acronym.
Always have problems with
Rolls
that
off your
acronym,
tongue.
but so we want to. Our objective is, like your objective is, to make sure that the tests are valid, that the results tell us tells especially your customers what's in the water or not in the water. So we could coordinate that. Has the Extended Drinking Water Monitoring Plan been actually approved by the Department of Health and EPA?
So, one, we don't need their approval to do the right thing, but two, that approval is part of the incorporation of the ACO, is part of the incorporation of the ACO, and that we're close in finalizing that.
So actually, like in the LTM, both Department of Health signed and EPA acknowledged. Will the same thing be done actually on the plan, and when will that happen?
I can respond to that. EPA, because we are hoping to add it to the 2023 administrative consent, actually EPA will be approving and DOH will be acknowledging.
Okay, so there'll be two signatures from the two regulators in a reversal of roles on this
based
document.
on how we're managing right now the order.
Okay. Is there a timeline if we want to provide comments on that? I don't know if it's available that we can review the draft. Is there a timeline for providing comments before you actually put your John Hancocks on it?
So, we met with your team back in May and gave you guys have had a draft copy of it. You've had it for 6 months. So I'm not really sure if you haven't had comments to date.
That's the latest version of the plan. Or
Not the latest version, but we've yet to get any comments from your team in 6 months.
Okay, we're working on it. Thank you. This is a question for the EPA. I heard during your presentation, Claudia, that the focus has really seemed to be on JP5 in the water system. But I just want to remind everybody the experience of what happened, the horrible events of 2021. It started actually in May with the leaks, the pipeline break near tank 20 and 18 in the lower access tunnel, the lower tank tunnel, and the cleanup by using water and surfactants, how that maybe mobilized older fuels and chemicals that may have been hung up in the unsaturated rock in the vadose zone below the bottoms of the tanks and the top of the water table, which is in maybe 80 to 100 feet thick, much like a sponge. So why only the focus on JP5 when there clearly seems to be older fuels that was also involved in the contamination of Red Hill Shaft?
So as you heard earlier, the remediation part is going to be ongoing and long term. That was the impacted area. Right now, we are testing the Waiawa Shaft that was a completely different water source from Red Hill Shaft. So that's, I understand your concerns because
my concern is, you're looking at the impact on the water system from the 2021 events in a very narrow focus, almost like with blinders. Looking only at JP5 and maybe the related, hopefully the additives or anything else, but could you expand that, because it may not, unless you have proof that it was only JP5 in the drinking water system back in 2021, expand the investigation or the testing to look for other things.
Well, we are looking at other fuel indicators. So some of the other additional fuel indicators that we added are not just specific to JP5, they're specific to fuels as a whole. So we are looking more broadly to kind of ensure that we are looking at all possible petroleum fuels that could be in the water system. So that was part of the intended purpose, to expand that scope. And you saw the changes in the chemicals that we're looking at. So that was one of the reasons to kind of make sure, okay, we're looking at JP5, that's our intention, but then looking at these other fuel indicator compounds as well. And so far, I don't believe we've had any detections.
Yeah,
Can
thank
probably
you.
confirm.
So I wanted to make that point. So I'm glad that you're going to be looking broader and not just narrowly only for JP5.
Correct, and there have been no detections. And the other thing, too, from a contextual standpoint, I think it's important to note when the use of surfactants for the cleanup, I'll confirm this, but I think it was a total of a half gallon was the total volume. So we're not talking about hundreds and hundreds of gallons. It was a half gallon of surfactant that was used as part of the cleanup.
Oh, thank you for the clarification. Admiral Williams, was that half gallon used during the May event or the November event?
I will confirm for you. I believe it was the November event, but I will confirm. For you.
And was there any surfactants used during the May event?
I do not believe so, but again, I will confirm for you.
I appreciate it. Thank you.
Okay, so that's a follow-up then. Okay, if we're done for now, we can move on to the last of the sessions. Commander Dunn can stay where you are. And I want to thank the rest of the speakers. So let them exit stage right? Left, yeah, you're my left. And then we'll move into, this is the final agenda item before we take a break, well-deserved break. I know I want one. And then we will open it up to the public Q&A. I want to take this moment now, in case you don't hear it when I say it twice during the break. If you intend to ask a question live here in the audience, you need to have signed up in the front. There's a table there so that we know who to call upon. And we're going to take that sign-up sheet after the break, and we'll work from there. Likewise, when we get to the online one, you'll be, that's about the time at the beginning of the break when you can raise your hand in order to get in the queue if you're going to give an online one. Don't do it now because you won't be going anywhere. We don't activate that until the break is started, okay? So with that, gentlemen, why don't you lead us out?
Is this better for the online folks? Just to hold it up?
Yeah,
Okay.
definitely, please.
So we'll talk, we're not going to, again, Admiral Williams, Commander Dunn, we're going to talk environmental remediation, monitoring, site assessment real quick. I think, Ernie, your last question there about historical, the other fuels, I think this presentation will help answer what we're doing there to address that. So next slide.
Okay, so the Navy has been sampling and modeling groundwater at Red Hill for years. And after the 2021 November release has significantly increased the level of effort and the activities to further investigate. This slide or this graphic kind of overviews the numerous activities that the Navy has initiated since 2021 and is continuing to progress today. So there has been a lot going on in recent months and the last couple of years, and continue the planning, coordination, and execution today. I won't go into every one of these line items, but basically they're kind of categorized into groups of types of activities, and that's sampling and monitoring, including our groundwater monitoring well network, our site assessment, field investigation and characterization of the fuel releases, the remediation operations, which include pilot studies for actual remediation cleanup activities, and modeling efforts. So there's two independent groundwater modeling efforts ongoing. And this slide is readily available on the Safe Waters website on the environmental page.
If I could, just real quick, hold the mic direct, not at an angle.
Okay.
Thank you.
Thanks. Pro tip. All right, next slide, sir. Thank you. So although the Navy has established a network of 44 groundwater monitoring points, including the completion of 22 new groundwater monitoring wells since the end of 2021, the Navy is aggressively pursuing the installation of additional groundwater monitoring wells. The Navy is committed to continue drilling additional wells, targeting areas where we don't have any today and would like to investigate and collect data, specifically locations in the vicinity of Red Hill, which is outlined in yellow here on this graphic, and specifically in the boundary in the areas highlighted in the circled areas. The majority of the Navy's monitoring wells are positioned on site, focused on the area where the release releases have initially occurred, and then additional sites have since been established, expanding outward to include the off-site Sentinel wells in the greater area, so we can more closely monitor conditions in the aquifer and identify any concerns or potential migration. The graphic shows our understanding of the general regional groundwater flow direction as depicted by the blue arrows down the Red Hill facility and generally to the west. The areas of the wells that we are currently pursuing and planning today are located in these boxed circled areas, and these are areas that have various landowners, including federal, state, and private entities. And so a lot of coordination, communication, and proceeding through legal challenges must be considered as we plan each future well site. Potential drill sites are pursued through many discussions with subject matter experts and stakeholders for feedback, and wells are ultimately drilled where access is granted and we obtain a permit from the Commission of Water Resource Management. We, again, are actively pursuing more wells today.
So let me just touch on a couple things too. So while we're on, can you get?
Yeah, direct.
Okay.
Thank you.
So we are, the groundwater flow model, this reflects what we have recently submitted. So there was an earlier discussion about a model that the University of Hawaii had pointed out. That was a model from 2019. So the 2024 model that we've recently submitted to the Department of Health and the Environmental Protection Agency, and it is in alignment, or it's congruent with the USGS historical models, which is the southwesterly direction flow. Now that said, the groundwater flow models over the next 2 years, as the University of Hawaii does their work, we'll go, that work will go further to either to inform all of us on what is the groundwater doing, and this will continue to be refined. We also recognize from our groundwater flow model, the numerical model, does contain information that's considered defense critical infrastructure. We are bound by federal regulations, just like all utilities have to protect certain aspects of their system, vulnerabilities, operations, structures, et cetera. There is a path, right, specifically for BWS. Again, renew our offer from a non-disclosure agreement standpoint so that we can fully share information and have the legal protections in place so that we can stay in alignment with federal regulations, again, extend that offer so that we can share it fully. Otherwise, we'll have to continue to just share redacted versions. But the groundwater flow model, the regulators have it. We published it, or sent it to them 2 weeks ago, if I remember correctly. And again, it will go through an iterative process as the University of Hawaii completes their work next year, and that will further inform models going forward.
Next slide, please. The graphic here highlights the locations of both groundwater monitoring wells and drinking water production wells in the region of Red Hill. The white dots located are the Navy drinking water production wells, and the purple dots are Honolulu Board of Water Supply production wells. The Waiawa Shaft, referenced by an arrow in the top left, is the Navy's sole source of drinking water, and again, that's 6 miles from Red Hill, and that's been the sole source of drinking water for the Navy system since December 2021. The purpose of production wells is to supply drinking water to distribution systems, and this is again different than groundwater monitoring wells, which monitor the conditions of the aquifer, which is a source of drinking water. The production wells in black font annotated here are those wells that both the Navy and the Board of Water Supply chose to remove from service in late 2021. And it's important to know that the Navy wells that are not in service are still monitored frequently for potential contaminants. The Navy is also planning the reactivation of both of these 2 inactive wells, the Navy Aiea-Halawa Shaft and the Red Hill Shaft, and remain in close dialogue with the Department of Health and the EPA to coordinate these efforts. Additionally, the Navy established a capture zone at the Red Hill Shaft in January 2022 after the November release to draw groundwater and contaminants through the shaft and a treatment system. So this operates kind of like a bathtub. You pull the drain and it sucks everything in the tub towards that drain. And in the spring of this year, through close coordination with EPA and DOH, the Navy gained approval to reduce that flow rate, so reduce the pumping in the shaft to conserve water. while still sustaining that drawdown zone, that capture zone. And while doing so, we increased the frequency of our groundwater monitoring. We had been doing it monthly previously, which is fairly frequent for groundwater in general, but we increased it 50% to twice per month sampling to ensure, as that drawdown zone was reduced, that we have an increased frequency and oversight.
Okay. And then again, next slide. Oh, no, you're good.
By the way, you can see your slides right there, too.
Okay.
That's handy for
You
you.
see the bottom one. Okay. Okay, last slide, last technical slide here. While we continue to monitor contaminants at Red Hill, the Navy has also begun planning and initiating the remediation or cleanup activities at the Red Hill site, pursuing a holistic and integrated approach amongst these activities. The site assessment is really the foundational remediation effort. It will identify the presence or absence of fuel-related contamination and then characterize its nature and extent. It basically scopes what the cleanup effort will be. It's a deliberate and iterative, data-driven process, which generally follows a discover, assess, and investigate approach. It involves multiple stages which span years and decades. It may involve continuous monitoring and continuous risk assessment through that process. We're currently in the site assessment phase up in the top left, which involves a historical record review of past releases and an initial field investigation. And again, this is an iterative process. It's a lengthy process, and we do not want to go too fast and not do it right. We're not going to sacrifice thoroughness for the sake of expediency. However, while we follow the process, we are also not waiting to explore remediation technologies that may be available and have begun a few concurrent pilot studies such as soil vapor extraction, natural source zone depletion, passive soil vapor monitoring to collect pertinent data and information useful to the overall process and advance our position to be more effective. In addition to the site assessment, the Navy is also conducting a concurrent PFAS remedial investigation. And this is executed under the CERCLA program. I'm pleased to share that through the close coordination with and feedback from both DOH and EPA, the Navy's agreed to expedite the schedule of the PFAS remedial investigation and has already begun sampling for that effort. And we'll drill new wells to continue that investigation. The Navy is committed to addressing contamination at the Red Hill site and is committed to the preservation of the community's natural resources and Oahu's aquifer for current and future generations.
Yep, and just on the next slide, so again, additional plug for our additional resources where you can get information. I do want to also, there's two upcoming from an environmental remediation standpoint are involved in this space. We've got two events coming up on October 16th, so a week from today, we will do a webinar that will introduce to the public the groundwater flow model that we recently completed. And then on November 14th, we will host an open house. That open house, the focus on that open house will be the environmental remediation and monitoring and site assessment efforts. So those who have been to past open houses, the previous one we focused on an update on our decommissioning effort, the cleaning, the pipeline removal, and so forth. The November open house will be centered around our environmental efforts to clean up Red Hill.
Thank you, Admiral. And a question for the audience, or not for the audience, for you. Will that webinar on the groundwater flow model be archived and viewable on demand?
Yes. So the webinar, we're working. Actually, Dr. Lau pointed the challenges of getting to the. We found it. We did find it. We're going to get it to you. It is out there, but it was sort of, we found it kind of buried in a media library. So we're going to get it so that it's more cleanly. We did a past webinar in September. But we will publish those on our website and look to try to figure out how to get them onto our YouTube site.
Okay, yeah, because that's really important, obviously. Not everybody has time to register for something live. Okay, let's go to questions. Ashley?
Okay, so it'll take 6 years from 2025 to 2031 before you start implementing a remediation solution, right?
Not necessarily.
Okay, because I was going to say, is there any way to speed that up, and why will it take that long?
Yeah, again, I think we all want to go fast. What's on the slide, right, is a conservative view, and the important thing here isn't you know, our environmental remediation efforts is not going to be measured in months or years. It's going to be measured in decades.
Right.
And so it's about being thorough. It's about getting it right. And so while I think we all want to go fast, we don't want to sacrifice expediency at the cost of thoroughness. So what you saw there, that doesn't mean there won't be remediation efforts that take place. It's just, that's a sort of a broad brush view of, hey, the remediation process. But our effort is, as we identify things that we can take action on, we will do it earlier. And again, it will be an iterative process.
Right, because yeah, I know there's a lot of involved, and so it's going to be a lengthy process, and the process of remediation itself will take decades, and I'm aware of that. But yeah, I was like, oh, I hope it won't be 6 years before something starts happening. You know, like yeah, like you said, we all want to have something now, but yeah, I understand can't happen like this year. So thank you for clarifying that.
Okay. Any further questions? Use the wireless mic, please. Yeah.
Okay, thanks. Actually, if you go back to the slide or the slide with the schedule.
The master schedule?
The master schedule?
The master schedule. I think.
So that's the first slide, I believe, right? Yeah.
I think maybe to answer your question to Ashley, if you look at I think there is some added 3 site assessment efforts, soil vapor monitoring, natural source zone depletion study. So I think they're doing some pilots to their credit, although I think the success has been questionable. The effectiveness, shallow vapor extraction method hasn't really proven out, but they're doing some tests, some pilots. So I appreciate that. I think more needs to be done along those lines. But going back to questions now, the groundwater flow modeling report, Admiral Williams, when will because I'm not going to, I'll just say again, and now you always bring this up, just sign a bloody NDA and you'll get all of it, Board of Water Supply. And my response has always been, no, we're not going to sign a bloody NDA because we want to be able to share the information with our community. When will the redacted groundwater flow model report be available for us to review?
It will be at some point next month. I don't have an exact date, but we're working through that, the decrypt process, and it'll be next month.
Okay, we look forward to receiving that. Thank you. Also a question on the reactivation of Red Hill Shaft and Navy Halava Shaft. And by the way, one of my staff engineers told me that they just saw a bunch of contactors out there, GAC contactors have been delivered to the site. When do you have Department of Health approval to reactivate, Department of Health and EPA approval?
Yes, Ernie, that's correct. We have a granular activated carbon treatment system that was being put into the site there, and we are developing a permanent reactivation plan that will go to DOH for approval, but that has not happened. As far as granting the approval, we're not in that stage of the process yet, but we'll be getting close. So.
And since that location has PFAS detections, I think in Navy Halava Shaft, and your monitor well in the area had also PAH detections, and there might be some TPH detections there too. So, did you do a treatment study to address those contaminants, and would that be available for review?
The treatment system is designed to treat for all of those. And as a side note, for the Navy monitoring well 24, which had the pH detection, that has since been confirmed to be laboratory contamination. So that one lab report that reflected a detection earlier this year for that well is not accurate. So the updated lab report is available online.
And I just want to, I think I made this concern, I expressed this concern to the Department of Health and the EPA also, that when you start pumping, and I understand why you want to try to reactivate that, because you're basically solely dependent on one drinking water source. You don't have N+1 redundancy at all. But the idea, if you start pumping, especially a halava shaft, will it cause migration to quicken of contaminants maybe moving from the Red Hill facility toward the Aya Halava area? So I just want to repeat my concern there. This is a question, maybe my last question. Is the Navy testing for PFAS at all present? Will the Navy be testing for PFAS at all present and future monitor wells on a weekly or bi-weekly basis?
So the answer to that is no. The Navy conducted a one-time baseline sampling last year of our groundwater.
September, October of 2023?
Late 23, yeah. Yes. Collected that data. The Navy, as part of its PFAS remedial investigation of Red Hill and PFAS investigation for Joint Base, there are other areas, that is going to conduct continued PFAS sampling at all of those wells. We're drilling additional wells for the PFAS RI to collect PFAS sampling to support that effort. And then that will be re-evaluated after the first year.
Wait, maybe I missed that. So Ben, are you going to actually now test for PFAS at all your monitor well locations?
No. No.
I thought I heard a no, but then you mentioned something about new wells, and you're going to test for PFAS for new wells, but you're not going to do it on an ongoing, regular, recurring basis.
So there are, of the 45 or so, 44 wells, there's a little north of 30 that are included in that remedial investigation that will be sampled regularly through the first year and then reevaluated. And then there are 2 additional wells that will go in that are part of the RI, part of the remedial investigation that we're looking to expedite. So as part of so there's the broader Joint Base PFAS remedial investigation, and then we are working to accelerate the Red Hill components of that, and that's where those 2 monitoring wells, the 2 additional wells specific in support of that expedited remedial investigation are going in.
Yeah, that's my concern, because that is a limited investigation of the Red Hill site, the facility, to a few locations within the facility. But then I think and that's under CERCLA. But this rest of this work is, I guess, under RCRA. But it would make sense that the PFAS investigation be expanded to all monitor well locations, even monitor wells installed under RCRA. Part of the fuel contamination investigation, because now we're finding it in Halava Shaft, and we're finding not insignificant levels of PFOS there. So I'd like to know what's happening with PFAS in Halava Valley, and is that going to migrate to other wells? We also pick it up at our Halava wells on a regular basis. Halava wells is off, Halava Shaft is off, and I guess your Aya Halava Shaft also has occasional PFAS detections too. So really, I really strongly request that the investigation for PFAS contamination be expanded to all monitor wells done under CERCLA and under RCRA. Thank you.
Yeah, thanks, Ernie. The Navy investigates PFAS under the CERCLA program, so that's how it's being handled under the overarching process for the PFAS at Joint Base Pearl Harbor. So that's how the PFAS RI is scoped. Gets after the PFAS objectives under that program. I do also want to reiterate the groundwater monitoring data that the Navy's collected through its network of on-site and Sentinel wells shows that concentrations of the contamination that's been observed on site, it's decreased and it's stabilized. And in many cases, returning to a non-detectable or historical normal level. And so the data that we're seeing is just not showing migration off-site of contaminants.
Okay, so we can go to Melanie,
yeah.
Dr. Lau for the
Is it
last
on?
question, and then we can take a break.
Yeah, so I'm kind of sorry you put that slide down.
Oh, I'm
but
sorry.
That's okay, but basically, since we're talking about PFAS, if we can add that to the administrative consent order too, that would make me feel better that it's going to go on in perpetuity even after I'm dead. The other thing I noticed in the remediation action schedule is there used to be, I thought, one on water purification. I'm going to be the pessimist in the room and say that we're going to end up having to purify Joint Base water as well as Oahu water. So is there plans to have water purification added to this project schedule?
Maybe I don't understand. What do you mean when you say water purification? You're talking our military construction project for our water treatment facility?
Yeah, water treatment. Thanks, Ernie.
So that's part of they'll be part of the reactivation planning. So there's the GAC systems going in at Navy AIS shafts. And then the longer term, there's what you'll hear us refer to as P716, which is a military construction project that we're working to get congressionally approved and in the National Defense Authorization Act. That is about a $500 million state-of-the-art treatment facility that would be sited there to as part of a reactivation plan for the Red Hill shaft.
So there's another graph that says reactivation schedule that I don't see that you guys have and is already working on?
Correct. So we have it's outside. It's part of the reactivation plan for our water distribution system for two other sources. So it exists, and we can certainly add it to as far as throw another one down here, another line item about we'll call it the water distribution system reactivation.
Okay.
So.
Thanks.
Okay, good. So I think at this point we can close this part of it, take a much needed break, 15 minutes, then reconvene, and we'll go to public Q&A. And I want to remind you again, if you're in the audience, if you do want to have a spot to speak, you have to sign up. We have no other way of knowing. And the second is if you're online at the first part of this break, you'll notice that if you want to raise your hand, you can get in the queue. We'll take people in the order that they were lined up. Okay, so I've got 4:06. Let's go to 4:20. Thank you. No. Okay, if everybody could kind of get situated, we'd like to start the public Q&A. So I'm checking my messages real quickly. All right, so here's how we're going to be able to handle it, because I want to reduce the amount of dead time between transitions. We have 2 members online with their hands raised. And so, 4? I only see 2. Okay. All right, so here's what we'll try. We have 1 person in-house. We apparently have 4 online. So we'll start with 2 on Zoom. And Zoom operator is going to bring you up and be ready to unmute yourself when prompted. And I'll do the prompt, okay? So we're going to start with 2 in line, Mandy Fink, number 1, Meredith Wilson, number 2. Then we will go down here to the audience. And Susan, you'll be going at that point and using a mic. And then we'll go back to the Zoom and catch whoever else we didn't get. Before I proceed, was there anything else anybody from the FTAC committee needed to clarify before we start? I think I may have heard that in passing. Otherwise, let's just go straight to, okay. All right, Meredith Wilson then. No, excuse me, sorry, I jumped ahead of myself. Mandy Fink, and you should be visible. For our folks down here on the sides, EPA, DOH, Navy, It's best if, for Zoom, you just look straight in that monitor in front of you because you're seeing them. You don't have to turn your head to the stage here, and that will be a better camera angle. You'll be much more visible. And of course, please use the microphone directly.
If we need to refer back to the slide, are we going to be able to do that?
I think we can. We'll try to do that. We have the slide deck that you use. We have some additional slides that some of you may have sent in, and we'll try to find those as best as possible. Okay, sorry for the delay there, Mandy. Let's go ahead and bring you up.
Thank you. Can you hear me?
We can hear you. You want your camera on?
No, it's 11. It's 11 p.m. here in DC, so I'll keep my camera off.
Okay.
Admiral Williams, when you were asked by Ernie about if DOH and EPA had approved your extended drinking water plan, you condescendingly responded, "We don't need DOH or EPA to do the right thing." Sir, I'd like to first start off by reminding you that none of us would be here if that were actually the case. That is, if the Navy actually had a history of doing the right thing. The Secretary of the Navy wrote a letter to all of us impacted families in January 22 about his commitment to rebuild trust in the community. I sat at Admiral Paparo's confirmation hearing here in DC when he committed to Congress to rebuilding trust with impacted families. As part of the AOC, you were mandated to attend CRI meetings, yet you haven't attended a single CRI meeting since Admiral Paparo took command of INDOPACOM. Do you believe that you are upholding the Secretary's promise to our impacted community, Admiral Paparo's commitment to Congress, and the AOC by continuing to refuse to attend our CRI meetings?
Okay, so that is a question to Admiral.
So with regard,
you have to switch it on if it's not already switched on. Otherwise, I'll get you a mic. Okay.
testing. Is it working now?
Yes.
So with regards to attendance to CRI, that is, again, ongoing discussion between the EPA and the Department of the Navy, the Secretariat, about ways forward with ground rules, having a mediator run the meeting, and et cetera. As soon as those things are finalized, and that challenge is worked through, I would expect that we would be back. But until such time, until the basic rules of engagement, so to speak, in how the meeting's going to be run, and how we're going to treat each other in a public forum with appropriate decorum, we will continue to engage in other ways. So with regards to, CRI is one of many ways that we engage the public. We have open houses, we have webinars, we meet, we go to neighborhood boards, we have, we attend, or we have our drinking water booth out and about. We go to public speaking events, whether it's Rotary Club or other events, as we are invited to update folks on the progress that we're making and the effort that we're undertaking to bring this facility to decommission and environment and remediate the environment. So it's one of many ways, but it's not the only way that we communicate with the public.
Maybe I could restate my question so that you could answer it, because you didn't answer my question. My question was, do you believe that you are upholding the Secretary of the Navy's promise to our impacted families, Admiral Paparo's commitment to Congress, and the AOC by refusing to attend our CRI meetings?
So again, our commitment to engaging with the public and our commitment to communicating with our various stakeholders is not met.
My question is very specific about the CRI meetings, sir.
Okay, so I think that's probably the answer you're going to get.
Okay, I have a second follow-on question.
Okay.
Sir, the Navy never disclosed the May fuel spill to the public, knowing it had not recovered and accounted for all fuel during its cleanup. Was that the right thing to do?
So I think all of that is cleanly documented. There's various Kavanaugh reports. There's a bunch of investigations that have occurred. I think.
For the sake of time, sir, these are all yes or no questions. You talked about the Navy doing the right thing. You didn't need EPA or DOH to do so. So that was just a yes or no.
So Mandy, you can't see the image here, maybe you can, but I think he said he would, he tried to answer and he's declined.
Okay, the Navy didn't tell its residents about the fuel spill in November, even when residents were smelling, their homes were smelling like gas stations and thousands ended up in the hospital. Was that the right thing for the Navy to do?
So again, I cannot comment on what folks that were in these seats back then. I can tell you what my team and I and what the task force is doing and our focus is. We're not here to rehash and re-adjudicate events from 3 years ago. What we are here to do is
No,
look
I appreciate
forward.
that. I was really making comment to your comment about you all doing the right thing and not needing anyone else to do that. My last question is, because you talked about this evening, the Navy flushed our fire hydrants, they flooded our streets, and they kept our sprinklers running for 24 hours the weekend prior to ever conducting a single water test. Was that the right thing to do, sir? And then if you're not going to answer that, the Navy did not issue a do not drink notice to its residents, to its own people. They also didn't inform us that the DOH did. So was that the right thing to do?
Mandy, in all fairness, could you just let him answer the question one at a time? Otherwise, it's
Sure.
hard.
Oh, yeah, sure. They're just yes or no, and I'm not hearing a response,
Thank
so.
you.
I was not here, so I cannot comment on the decisions that were made by the folks that were faced with the incredible challenge. Again, this goes back to decisions that had to be made by the interagency drinking water team, decisions that were made for folks that were dealing with the crisis in real time. I'm not going to sit here and Monday morning quarterback those decisions by folks, right? There's plenty of lessons learned. There's plenty of things, and there's a revisionist history, and there's always lessons learned to be gleaned. But to sit and criticize decisions that were made is unfair to those individuals who were faced with an incredible task that was caused by the Navy, right? Let's be candid.
Sir, I appreciate you, I'm not sitting here criticizing, I'm asking very direct questions. And you're refusing to answer, which is fine. But I just want to reiterate the fact that you told Ernie Loud tonight that we do not need DOH or EPA to do the right thing. And I've asked you very deliberate questions if you felt like these were the right things to do. And you've not been able to answer that, and that's fine. I'm done. Thank you.
Okay, thank you. And actually, before we move to the next Zoom speaker, it may not be possible, but it's very hard on the audio in here if you're using a microphone built into the laptop. If you have a headset handy that has a mic and can easily plug it in, it will help everybody. I realize that that's a last minute kind of information request, but if you have it, great, use it. Let's now go to Meredith Wilson on Zoom. Susan, well, no, we were going to do 2 on Zoom and then 1 live. Okay, so we'll do that then. Oh, I'm sorry, I didn't see Susan. I was thinking Susan in the audience here. Okay, my bad. Susan Gorman-Chang.
Right, can you hear me?
Yes, yeah, loud and clear.
Okay, good. Okay, good. So my question is for the EPA, is Claudia still there?
Claudia, yes, Claudia's here.
Is the EPA still there?
Yes, Claudia's here. Claudia, if you
Okay.
want to stand up, when you're answering, you'll be more visible.
Yes, please. Did I hear you say that EPA has, in any of their samples, has never found total petroleum hydrocarbons in any of the samples? Did I hear that right?
No, we said that we haven't found JP5 for fingerprints in the chromatograms.
So, okay, so I'm looking at this report from EPA, and actually an interview with Amy Miller that says we found trace amounts of total petroleum hydrocarbons. This was from a report dated December 18th, 2023, and it says the drinking water samples detected the presence of petroleum hydrocarbons as diesel. So did you ever follow up on that?
I'm not sure exactly the report you're referring to, but we do follow up on all the TPH detections to determine if they are related to the JP5 fuel release. And what I said
This is the
earlier was that
report when the EPA came out and tested, I think, 4 homes, report dated December 18th, 2023. Okay, so concerning that same report, it also said the EPA, that one of our EPA inspectors did see a sheen of sheen on a glass of water that was poured at the house. Okay. Also in the same report, this is a quote, and this is a question for the Navy. This is a statement from Navy Regional Hawaii. Quote, despite the fact all results indicated samples met safe drinking water standards, the Navy is continuing to work to identify the root cause of trace amounts of petroleum hydrocarbons detected in 3 of the 4 water samples. And remember, the EPA's report says these are detected petroleum hydrocarbons as diesel. Did you ever follow up on that, and what was the result?
Hey, good afternoon, it's Commander Dunn. So we have followed up with that. That led into the swarm event, that root cause analysis that was conducted. That swarm tech memo that's available on the Safe Waters website is very extensive. It has a lot of the data. It evaluates multiple lines of evidence to the conclusions of the findings
I understand that, but we
with that
also know
method
that
and
the
so
Board of
forth.
Water Supply just presented some evidence that we don't agree with that, so.
But let me clarify. Let me finish, please. About
Okay,
total
sorry.
petroleum, no problem. Total petroleum hydrocarbon detections. That doesn't necessarily equate to petroleum in the water. It's total petroleum hydrocarbons can be hundreds of different compounds, and so that's really when we have a TPH detection. That's a screening tool, really, to do additional follow-up action, as you were alluding to, which the Navy and the EPA has investigated that report, those findings from late 2023. That was part of that trend of increased petroleum hydrocarbon detections. That's what led up to the root cause and the findings, and then the evolution for refinement as we went into
And do
the
you have,
EWM.
I guess we could just agree to disagree. Okay, thank you.
You're welcome.
Great. Thank you very much, Susan. Actually, let's just do one more Zoom because we only have one more, and then we'll go to you. It just makes it easier to, get the flow going. Yeah, okay. So let's call upon Meredith Wilson now. And oh, by the way, before I forget, Elizabeth Boyle, the second speaker from the National Academy of Science, she is on the webinar again. It's probably like 1 a.m. for her, but she wanted to be there in case anybody has any questions specifically about that. So if that comes up, she's there. Okay, Meredith.
My audio okay?
Yes, you're fine.
Thank you. Aloha, everyone. I do want to say, first off, I do appreciate everything that's being done currently. We don't not appreciate everything that is being done, but our questions are to ask questions about things that are maybe missed, because there's a lot of eyes on this and it's a very complex problem. So please don't take our questions as being accusatory. We are just trying to figure things out altogether. I have 5 questions. I'll try to be direct about who they're for, and I'll be succinct so that you guys can have a longer answer. My first one is to the EPA. Why did you wait so long to do an audit on how the Navy does their sampling? For years of sampling of something that's really important, they missed an entire step, so they are technically non-compliant. Why did that audit take so long, and when will we have the results of that audit? Number 2 is for the Navy. As my understanding that lead concentrates when it's stagnant, and when you take those samples, it was a little confusing earlier because I was under the impression that it was stated that lead is not usually taken at a consumer's tap, which is just not true. The EPA website gives specific sampling methods about coming from the consumer's tap after stagnation of several hours. 6 to 8 hours is even stated. Sorry, that's my cat. But is that being done? Is the stagnant water being done at the consumer level for a first draw sample for lead? Number 3 is also for the Navy. In their EDWM, they mention health risk assessments that involve toxicity values. We do not have a toxicity value for JP5, and it's stated that there is going to be a method developed for that. I do request, and is there going to be a public comment period when that method is developed? So a JP5 toxicity value. Number 4, almost done, for the DOH. This is more of clarification. It is relevant. It is my understanding also that Hawaii is a part of something that's called the DoD State Memorandum of Agreement, so DSMOA program. Is it true that the DoD provides funding to the Hawaii Department of Health HERE office positions, and the HERE office creates EALs? So is that true or no? And then finally, for the EPA or DOH, I would like to request the Red Hill Remediation Roundtable to be at least accessible to the public. The BWS supports this. It's even listed under public engagement on the Red Hill website. We do not, accept just summaries. We'd like to be involved. If it's, considered a public engagement, it needs to be. I think that's all I have for now. Thank you.
Okay, thank you. So got actually 5 questions, so let's kind of churn through them by first turning to EPA on the audit question. Claudia, you want to handle that one?
Yeah, I'll.
Oh, is Amy
okay.
online?
Okay.
Okay, we're gonna have to switch you out, Meredith, so we can bring in another online, so you should be able to hear her. Let's bring in Amy Miller.
Hi, everyone. Can you hear me?
Yes.
Okay, great. The question about the audit, it is an iterative process here. We began last year. Complaints, we received home complaints, we investigated those. It led us to look at the lab results, which hence, as Commander Dunn mentioned, the swarm team and looking at how the samples were taken. At the point that the Navy has begun the extended drinking water monitoring plan, both EPA and DOH considered different ways to look at data through independent sampling. In addition, we decided to do a lab audit. We wanted to get the sampling going for some period of time before we had somebody review the sampling approach that the Navy was taking. So that was done in September, and we expect to report within 60 days of that audit of the sampling. Thank you.
Okay, let's now move to Navy. You've got 2.
First one was lead.
Lead sampling
method. Yeah, we're very proud of our lead sampling program. So please realize that there's different sampling efforts done with different objectives. So the sampling done under EDWM or that was done under LTM is different than the sampling that is done to comply with the lead and copper rule that's part of the Safe Waters Drinking Act, right? So that lead and copper rule sampling is where you would do the first draw sampling, right, where it's stagnant water, so that allows, right, for if there is lead and copper leaching into the water, you would ensure a maximum amount of contamination detected. So we were very proud of those results. Those results are contained in our consumer confidence report. So that's, when we talk about Safe Waters website, that is the LTM or EDWM results. There is a link on the Safe Waters website to the consumer confidence report that is actually the Joint Base Water System. The Public Works Officer there oversees that, and those results are, as you'll see, I think we are as good or better than from a 90th percentile standpoint, what I think BWS has, or we're no better, no worse kind of thing, right? And again, I want to reiterate one thing: is lead. We recognize, right? Lead is a complicated problem everywhere. It's an everyone, everywhere problem. That's why that's why EPA has the target level or has the action level of 15. But even as their updated 24 rule, which I don't think that's in effect yet, identifies a target level of 10 parts per billion. So we will continue to monitor for it. We will continue to test for it in different ways. We will do the first flush. Or after flush, we will do the first draw, and those will be done under different programs. Again, lead and copper rule compliance monitoring versus EDWM. And what was the next one?
Okay, and then, yeah, the second one, if you don't recall, is about the EDWM. And, oh my gosh.
Yes, for health risk
Right.
protocol for JP5,
Yep.
which is true, that does not exist. We're in coordination with the EPA about a health risk protocol affiliated with the Extended Drinking Water Monitoring Program. Those discussions are ongoing, but I'll offer EPA if they would like to add anything further to the point. But yes, no risk evaluation protocol for JP5 exists. We look at specific analytes, JP5 being a conglomerate of numerous.
I think the question from Meredith was toxicity values.
Toxicity values?
For JP5?
Oh, yes, okay.
Yeah, and those are, again, doesn't exist for JP5. We measure the individual analytes and the compounds, some of which do have MCLs.
Okay, now over to DOH regarding the DOD funding for the HERE office. Kathy, do you want to take that, or is it working?
Yeah, thank you for the question. Unfortunately, our branch chief for the Hazard Evaluation and Emergency Response branch is out of the room taking another call. But my understanding is that we do have an MOA with DOD to oversee formerly used defense sites. Examples of that is oversee the cleanup and investigation remediation. Examples of that is things like UXOs on underground unexploded ordnances on the Big Island. We've been working to do some cleanup there. The Radford cleanup, we've been doing some work there. Basically, any formerly used defense site, the HERE office oversees the cleanup.
Okay, and then the final one in that part is for Department of Health and EPA regarding Red Hill Roundtable, and I see Claire Tannenbaum is there. You may have to switch the mic on.
Okay.
It is? Okay. It's on.
Can you hear me?
If you could speak up a little bit.
Yes. And it's Claire Trombador, just so you know.
Apologies.
Not Tannenbaum. So, yes, EPA originally had the idea for putting together this roundtable, discussed it with DOH, and the original purpose was to bring key partners and stakeholders in early to help inform our planning and development of the work, the environmental work for investigating and remediating the releases to the environment at the site. We were able to get the Navy to buy in and attend the roundtable so that they could present to key stakeholders. It's been Board of Water Supply, Seaworm, U of H, and we can then take input here. Hey, I wouldn't do it that way. You need to work on your schedule. You need to take this into consideration. And then we further task our subject matter experts to meet thereafter to delve even deeper. So it's usually higher level folks in the various agencies coming together. It is not a public meeting, which is why we haven't been inviting the public. It's really a working forum to get early input so that we hopefully don't have to keep redoing work we can hear earlier on. We did provide these summaries for the public. I'm sorry if those are not hitting the mark. I will take that back and work on it, but that's really what the roundtable was, a technical working session at a high level to get early input on the work.
Okay.
Thank you.
Thank you, Claire. And now, Susan, if you want to come up. Susan Cola-Davis here in the audience, and then we'll do the final two online commenters. Kathleen McClanahan, we're going to get you
Can I walk
audioed up. Hold on just a second, Susan. McClanahan, we're going to get you audioed up in some way or fashion. Hopefully your audio works fine. And if either you or Shannon has headsets with a mic, that would be very helpful. It should be. Go ahead.
Hi.
There you go. Okay.
As we feel like what it feels like in the...
I think you need to speak a little louder.
Sometimes it feels this cold just before winter. So I put together a board, as usual, because I do not get a slideshow. But the 4 regulators, Ernie and the Navy, all have a hard copy of some of the stuff that I'm going to say. But I'm mostly focused on the Extended Drinking Water Monitoring Program. And what I was thinking about when it was, 6 months ago, when I was talking about some of this stuff, we got through laboratory contamination, quenching, sampling, forensic testing, EALs, MCLs, and then the Department of Health came out with the 2024 evaluation of environmental hazards, and then we just talked about the lead and copper rule. So what I'm doing today is I went back into the Safe Waters database, the interactive map, and I switched from lead since there wasn't anything for me to do anymore about that. And I went back to total petroleum hydrocarbons. And the reason I did that was because I wanted to see how the new sampling was working. And originally I thought it started in March, but it actually started in April. And the largest number of detections, strange thing for me is it's fire hydrants. So there's lots of TPH coming out of the fire hydrant sampling. Now, hear me, I'm not making any analysis, I'm just talking about the numbers. No opinions, just the numbers, okay? So then, as I was reading the final drinking water action levels for human toxicity and for the tap water from the 2024 Department of Health publication, we will be having new EALs once it's finalized. For gasoline would be 74 MGL, and then the middle distillates, which is diesel, will be 91, and the residual fuels, which is oils, will be 91. So when I was looking at the numbers, and I know that we're doing forensic testing and forensic sampling, so the results aren't under compliance rules. It's more of this investigation since, I'm going to call it the Chris Waldron report. And what I did find, though, were several areas that, if you saw my graphs, you would see that there were areas that have high TPH. And so part of my presentation is communication with the residents. I don't think anybody's ready to say that I'm not comfortable, and also remember that if I say we or everybody, I'm just talking about me, myself, and I. 3 people, not anybody else in the room, just myself. So I'm not totally ready to say everything's good to go. And it's because sometimes when we find something and it's in a residence, there needs to be something communicated to the resident. And so my question is, there's no questions. My statements are, you spoke with the resident, you left a message on their door, you left your phone number, we offered them other sources of water, and we did nothing. which I don't think that, well, who knows? I don't know what they're doing. But the purpose is, when you get a test result and it has to go to the mainland for 14 days, you have to make a judgment call. You have to make a decision. You have to not wait for final approval to do the right thing. And so maybe you have to make a judgment call in some of the homes and say, yeah, well, let's take care of that. But my favorite thing to do is my reveal. And nobody can see it but me, but I'll read it to you. On July 23rd, 2024, a home in Capulina, 4917C, Mokupea Place, that is zone A3, had a sample taken. Diesel was at 145 and oil was at 245 with a total TPH of 390. I'm not saying that nothing was done. I'm just saying this is what I found. And then on July 11th in Earhart Village, 223 Puapilo Court, that's zone D3, diesel was at 62.3, oil was at 47.4, and the total was at 109.7. So the purpose of some of my research was to find, is there still, am I still finding diesel, oil, and gasoline? And the answer is yes. And from what I have found, those were the numbers that I received from looking at the Safe Waters website. I don't have any questions, but if you have a question, I'm more than willing not to answer. No, I'm willing to answer it, but I don't think there's any questions.
Thank you, Susan. Thank you very
you.
much. Okay, and now we'll go back online, and hopefully Catherine is able to join us. Our other person, Shannon, had actually withdrawn from the queue. So Catherine, you'll be our final speaker, it looks like. So please bring Catherine up.
Hello, can you hear me?
Yes, we can. If you want to use your camera, great. If not, fine.
I've got it going if it's going to decide to adjust. Okay. I have two statistics I'm going to give, and then I have two questions. First of all, as families who want to understand the full effect of what happened to us throughout 2021, here's a statistic that I find concerning. Commander Williams and Commander Dunn, I know that today, in the last few weeks, you've spoken about how fast you get test results to regulators. But just looking back at the data, I took mid-June to mid-July 2021, and I could have done this really to any sampling reports of 2021. The average time you've been saying recently was 2 to 3 weeks. Throughout June and July of 2021, that number was 70 days. So not 14 days, not 21 days, but the average time from the last test completed by the lab, so the last date analyzed, and the time that the report was produced for regulators was 70 days. Second statistic, according to my calculations from May, taking every water sample report provided on Joint Base Pearl Harbor website, between May and November of 2021, I find approximately 14% of the samples missing. Between November 15th and December 15th, 2021, I find approximately 25% of the samples missing. I hope my calculations are wrong and that there may be other reports. Here are my two questions. Third thing, regarding fuel system icing inhibitor. Looking back from January of 2020 all the way to April 2021, every report produced by the Navy on the Joint Base website produces and shows that 2-MeE was tested for. But suddenly, the end of April 2021, there is no longer any 2-MeE testing, which is the fuel system icing inhibitor. The next time we see that test resulted on any of the reports provided on that website, that I can find at least, was the end of July 2021. So my question to the Commander Dunn or Williams, did the Navy or your contractors ever test for 2-MeE between April and August of 2021? And my last question for the Navy as well, when you have an exceedance reported to you by the lab, what is your standard of practice? Do you ever simply wait a certain number of days and then resend the same sample ID numbers back to the lab? I find this question to be one of the most concerning questions I have of the night. I found 7 reports in 2021, in the summer of 2021, where the lab openly states that they've received these lab sample IDs on 2 different dates. Those dates appear between 3 days, 5 weeks, 7 weeks, 4 weeks, 6 weeks, and 12 weeks. Can you answer to why that practice of sending those dates, sample IDs on multiple dates would be allowed?
Okay, so we've got 2 questions. Hopefully you remember them both. If not, we'll have to get clarification.
Well, I mean, so one, we appreciate you bringing up the concerns. We're going to have to go back and look at, again, neither one of us were around in 2021. We'll take it back and investigate it and get you an answer. I can tell you only what we've been doing under at the end of LTM and EDWM, that you know, as we investigate it, that does not sound correct. It sounds abnormal. So if we can get with you offline and get the details of those examples, we'll take it for action.
So that pertains to both questions? Okay.
So I'll probably provide a little bit of amplifying information. So you did talk about what's the process when we get data for, so under the drinking water programs that we've been operating under for the past 2.5 years, there is an established protocol. So when we get a result such as an exceedance, then we follow the protocol. There's notifications to the resident, the regulator, there's alternate water offered. We immediately go through a flushing and resampling protocol. But I think the 2-MeE analyte might be a groundwater data rather than drinking water data. And so, again, Admiral already clarified, we were neither here, so I can't speak to 2021 data and protocols, but also want to make a clarification that there is a big difference between groundwater monitoring and our drinking water monitoring. It's different standards and different protocols and frequencies, but we do use EPA certified labs for both of those programs and running all of those analysis, and that requires samples to be shipped to the mainland to analyze, and that's why it takes weeks to get the validated data back.
Okay, so let me just have a follow-up question about that. So the samples included both, I see, but yeah, I would like to hear more about that, considering that seemed to be a sudden drop-off and then no resuming. But how about as far as the practice, is if you understand, I hear what you're saying is that you have a standard practice you began after the November leak. But wouldn't that standard of practice apply all the time? That if you have an exceedance, you immediately notify, close the well, identify the contaminant. I guess my question is, why wouldn't that apply throughout all of 2021? Or I guess throughout all of the years?
So I think, so the drinking water monitoring, we do under Safe Drinking Water Act compliance monitoring. And so some of the aspects of that monitoring compliance program don't quite marry up. Maybe they're percentages of total samples and so forth. But I would believe that if there was a concern identified from data received, then there would have been action taken. The volume of samples that we take during the groundwater monitoring and drinking water monitoring over the past several years, because there is such a large volume, there is a pre-established, pretty explicit and short timeline, deliberately developed protocol that we follow.
Okay.
Okay, well, I would love any offline information, because 70-day average for return of results
So,
and multiple weeks would be greatly appreciated. Any further info offline.
right, so you have her contact information? Yeah. Okay, great. All right, thank you very much, Catherine. And it turns out we did have one more speaker online. Shannon Banks, apparently your hand had disappeared. We thought that you just declined, and so we got you back up. So let's go.
Awesome, thank you so much.
Yeah.
Can you hear me?
Yes, we can.
Hi, great. Shannon Benz here. These questions are for Navy. So going back to the fuel facility as a whole, because we're trying to make the place safer, right? So just because Red Hill proper is shutting down does not mean the whole fuel facility is being shut down, correct? So that means that the fuel facility is still operation down at Joint Base and over to Hickam, which means you still have underground storage tanks, other ones other than the Red Hill tanks, and underground pipelines, right, that require upgrading and double walling. I think the HAR says 2028 for the pipelines. So my question goes back to the safety of the people, safety of the workers, safety of operators. Has the Navy finally adopted commercial regulated training such as API, American Petroleum Institute certification, so these operators know what they're doing, because it was never a requirement? And are you also adopting, what are you doing to make the facility safer per the HAR going forward?
Okay, I'm not sure if that was clear because the audio is a little funky.
I think you're asking about the ongoing, so Red Hill Bulk Fuel Storage Facility, right, is decommissioning, but you're asking about the remaining fuel distribution system on Joint Base Pearl Harbor Hickam?
Yes, it's one fuel facility, even if you close down Red Hill, right? It was always one fuel facility, DFSP Pearl Harbor, Red Hill, you call it whatever you want, but it's all connected. That's how the state regulated it, right? Underground storage tank facility. It's still attached, right, down to Joint Base and to
It is not attached.
Hickam, Pearl Harbor.
It is not attached.
It was still attached prior to decomming the tanks, right? So that being said, the underground pipelines and tanks, there's still underground tanks at the facility, correct? When it's detached from the Red Hill tank?
Shannon, if you could just let him take a breath to answer.
So that we have air gapped the surge tanks, or we're air gapping the surge tanks. We have air gapped the pipeline from the underground pump house. So Red Hill Bulk Fuel Storage Facility is not connected to the underground pump house. It is not part of the Joint Base Pearl distribution system anymore. Okay, so and now in regards to the operations of the Joint Base Pearl Harbor system as an entirety, we can get you in contact with the folks that are in charge of operating that facility. That is outside the purview of our mission here, right, which is to decommission Red Hill and an environment that, remediate the environment. So we are not operating the fuel facility and the remaining fuel as a defense fuel supply point. But maybe clear, right, the pipelines are disconnected from the pump house.
Yes, sir. However, there's still a danger to all the other underground pipelines running around the base, correct?
I'm not tracking what you're saying. I apologize.
Shannon, maybe if you could ask us a very direct question. To be quite honest, your audio is very tinny. I don't know why it is, but it's really hard to hear.
Okay, let me just better. Can you hear me better, hopefully?
That's much better.
Oh, okay, great. So prior to Red Hill being disconnected at the underground pump house, it was one fuel facility. And the dangers were throughout the entire fuel facility. It wasn't just the Red Hill tanks. It was the pipeline system and the maintaining of the system and the underground pipelines that ran throughout the base. That is still a danger if not upgraded, and the HAR requires them to be upgraded by 2028 to have secondary containment, at least for the underground pipelines. I was asking for the safety of the people and the community and the people that live there if those upgrades will occur, and if the operators operating the facility that still exists finally have commercially graded training to operate safely.
So I can't speak to what the status of the capital improvement projects are in place to address those concerns. We can take that back and talk to the appropriate parties who have that requirement to take action on. And the same thing goes with the training for the folks that are operating. We can take that question back and pass that along.
Okay, so
Thank you,
that
sir.
will
I
be a
appreciate
response back to
Yep.
Shannon Banks.
Yep.
Okay. Thank you, Shannon. I appreciate that. So with that, we're Powell with the public comment period. And I want to turn it back over to our chair, Kathy Ho, for the dubious honor of...
Thank you, everyone, for coming and for being respectful of our speakers. Oh, sorry. Ernie, do you want to say something?
Yeah, if you don't mind, Kathy, before
you want to announce your thing?
Also, after this meeting, if anybody would like to come to the Board of Water Supply, you're welcome to come over to the Board of Water Supply, free parking. Please join us. But Kathy, if you don't mind, I'd like to make a recommendation for an FTAC recommendation to the legislature. The FTAC is a fuel tank advisory committee.
Ernie, I think you have to get closer to your mic.
And part of our duties are not just to be able to be present for hearing very informative presentations, being able to ask questions, allowing the community to ask questions or provide testimony, but also to make recommendations to the legislature. That's why we have an advisory role. So I just want a simple recommendation that I'd like to put on the floor for us to consider is that the FTAC meetings, which are semi-annual, and we can see semi-annual is just, I don't think, enough. There's so much information to cover that the agendas are taken up with very little opportunity for a lot of question and answer and focus on details of the subjects that maybe we should go to quarterly meetings instead of semi-annual. There's two more meetings a year. I think our agendas will be much more focused and give opportunity for ample discussion and also maybe community involvement to testify. That'd be my recommendation. The other part to Kathy, if you don't mind, I'd like to request that for the next FTAC meeting that unfortunately with Joint Base Pearl Harbor Hickam happening, things that were under Air Force responsibility and also Navy now are all under the Joint Base Command, which is under the Navy, so NAVFAC. A detailed presentation from the Navy and our Department of Health HERE office, HEER, on the Hickam POL pipeline. That's the petroleum oils and lubricants pipeline that connected the Waikakalawa Fuel Storage Annex and the Kipapa Fuel Storage Annex. Waikakalawa was located up in Wheeler Air Force Base, and Kipapa is now was actually located now in the Mililani area, and they connected. So fuel was pumped from Pearl Harbor, I think, up to these tanks further inland, and then also brought down by gravity back to joint Pearl Harbor and Hickam Air Force Base. So I'd like that detailed presentation on that at the next FTAC meeting. So that's my two requests.
Yeah, so why don't we take that up at the next FTAC meeting? If you have, because we have to properly put it on our agenda and to be vetted by the FTAC members. So we'll put those on the agenda. If you have language that you want to introduce for the legislature, you can present that at the next FTAC meeting.
Well, when is the next FTAC meeting, Kathy?
I don't know, sorry.
Is it actually next year after the start of the legislative session? I think that we had one in March and now in October.
That would be in March, yeah. So we'll have to we might have to have a special FTAC session. I'll have to check with our lawyers.
Yeah, I'd really appreciate that. You know, we could actually, because there's an annual report that's submitted 20 days before the start of the legislative session to comply with this state law, that might be a good time for us to get the draft report ahead of time and provide comments and discuss the report, and maybe adopt the report before submittal to the legislature.
Great.
Thank you.
It's not a motion, but okay. All right. Anyway, thank you very much, everyone. We'll see you, FTAC members. We'll be in touch maybe sooner than later. And the rest of you, thank you very much. Maybe we'll see you later. Thanks.
Okay, thank you. Aloha.